Today marks a pivotal moment for TCI. We are not just here to celebrate success. We're here to showcase transformation. The 9 cities with us today have not simply implemented programs. They have revolutionized how we approach family planning and adolescent health in the Philippines.
Let me share some remarkable numbers that tell an incredible story. The Challenge Initiative continues to make remarkable strides in advancing family planning and adolescent health across the Philippines. To date, TCI has reached 14.4 million individuals. That's 13% of the country's total population. In 2024 alone, local government units have committed to over $4 million, or roughly 222 million pesos, to sustain and scale up of FP and AYSRH interventions.
We've also seen strong leadership engagement with 24 mayors and 360 city leaders actively supporting the movement. At the heart of our success are our people. 947 master coaches trained to guide, mentor, and inspire change at the local level. TCI proudly partners with 24 highly urbanized cities across Luzon, Visayas, and Mindanao, each demonstrating how local ownership drives sustainable results. Our collective efforts have resulted in over 209,000 additional family planning clients, reflecting real impact in communities.
To reach and serve more Filipinos, partners have conducted over 21,000 outreach and demand generation activities, bringing essential health services closer to those who need them most. Today, 577 health facilities offer adolescent-friendly services, while 780 facilities now provide post-pregnancy family planning, ensuring no woman is left behind. Behind these numbers are lives changed, futures secured, and communities empowered.
To officially open today's celebration, we are honored to welcome a visionary leader with extensive experience in public service and health governance. Having served almost 3 decades in various capacities at the Department of the Interior and Local Government, where he was Undersecretary from 2007 to 2018. He now serves as President and Executive Director of the Zwilig Family Foundation.
Please join me in welcoming Sir Austere Panadero.
Thank you, Jan and Pam. Magandang umaga po sa ating lahat. Maligayang pagdating po dito sa Manila, lalo na doon sa mga lumipad, naglakbay ng malayo, kahit na doon sa mga taga Metro Manila na siguro 2 oras bago nakarating dito. On behalf of the Zwilig Family Foundation, I extend my warmest greetings to our city leaders, health officers, and partners from the Department of Health and Commission on Population and Development. Today's colloquium highlights the journey of 9 cities: General Santos, Iriga, Isabela de Basilan, Lapu-Lapu, Mandaluyong, Pasig, Quezon, Tacurong, and Tagum cities, as they join our growing community of self-reliant cities under the Challenge Initiative program. Our theme, Sustaining Momentum, Transformative Reproductive Health Impact Through Data-Driven Leadership, reminds us that leadership anchored in evidence leads to meaningful change. Change that can be seen, change that can be measured, and more importantly, change that can be felt by families and young people. Across Luzon, Visayas, and Mindanao, 24 component and highly urbanized cities have embraced this approach. So nearly 1,000 master coaches trained, over 159,000 family planning clients served, and hundreds of facilities now adolescent and post-pregnancy friendly. These are not just numbers. Ito po ay mga kwento ng pagbabago of stronger systems, more capable leaders, and communities and families that now make informed and empowered choices. We are proud to share that 100% of the graduating cities have met the national adolescent birth rate target. That means more girls are staying in school, more young people are pursuing their dreams before parenthood, and more families are supported by responsive local systems. On modern contraceptive use, we see Quezon, Tagum, Tacurong, and General Santos cities exceeding national targets, showing us that leadership sustained by good data yields results. For cities showing declines, this reflects stronger data integrity, a sign of maturing local health information systems. We are truly inspired by the innovations that our partner cities have embarked on, and translating these innovations into very key actions and lasting change. For example, Tagum City mobilized its communities by engaging grassroots leaders, turning awareness into a movement. General Santos brought services to underserved women by forming family planning itinerant teams, ensuring that no woman was left behind, no matter how remote her barangay is. Lapu-Lapu City strengthened its barangay health volunteer system, turning volunteers into capable FP providers who bring care directly to the household level. Iriga City empowered indigenous peoples through culturally tailored family planning initiatives, while Isabela de Basilan broke communication barriers through translation services and localized IEC materials, proving that inclusion is key to equity. Mandaluyong City engaged its youth through the Adolescent Congress, peer educators, and SK leaders who now speak confidently about health and rights. Quezon City took institutional reform to heart by passing ordinances and establishing its information and service delivery network for adolescent health and development, a model of system-wide coordination. Pasig City strengthened its own ISDN, linking health facilities, schools, and social services so that every adolescent who needs help finds it without barriers. And in Tacurong City, adolescent needs are now fully integrated into health service delivery, ensuring that every young person who walks into a health facility finds a safe space, listening ear, and a responsive system. Each of these 9 cities shows us that leadership, when powered by data and compassion, transforms systems and lives. Ito ang pamumuno na may datos, may puso, at malasakit. So as we move forward, the challenge is to sustain the momentum. Political transitions will come, but the gains we've built must remain. Let us use real-time data for adaptive and responsive management. Ang mga naumpisahan natin, kailangang mapagpatuloy at mas lumalim pa. Today, we celebrate 9 cities, countless lives changed, and systems transformed. Every data point tells a story of leaders who dared to act differently, a community that believed, and a system that worked. The Challenge Initiative, Philippines, and the Zwillig Family Foundation are honored to have walked this journey with all of you. Maraming salamat po at mabuhay ang bawat leader na patuloy na naglilingkod ng may malasakit at paninindigan. Good morning.
Thank you, Sir Austere, for that inspiring message. Your words perfectly capture the spirit of innovation and partnership that defines today's celebration.
Also, extending their appreciation to us today are our partners from the Challenge Initiative Global Institute. Let us hear a brief message from the founding director of the William H. Gates Senior Institute for Population and Reproductive Health, Sir Jose Oying Rimon.
Maraming salamat. I bought a Barong Tagalog yesterday, actually from Juan Simos, but I forgot to wear it today, and I'm so underdressed looking at all of you and your beautiful barongs, and especially the ladies too. I've only met 4 mayors so far in this journey. That's Mayor Magalong, Vico Soto, Joy Belmonte, and Daryl Uy, right, of the Pitan, or the Polog City. But I would like to meet all the other mayors who have bought into this concept. 8 years ago, I was at the Gates Foundation, and I used to lead the maternal neonatal child health, nutrition, and reproductive health programs at the Gates Foundation. I'm now at Johns Hopkins University. When this idea of the Challenge Initiative was first brought out, the idea was simple. How do we revolutionize the approach to health and development, anticipating that by 2050, 70% of the world's population will be living in urban areas. 70%. And 90% of that population will come from the cities of Asia and Africa. And about 70% of that 90% will live in informal settlements, sometimes called slums. So projecting into the future, how do we anticipate this problem and respond to these needs? So right now, Challenge Initiative is focusing on reducing teenage pregnancy, family planning, but it now has a strategy for maternal neonatal child health and nutrition, and hopefully other issues down the line as we move forward. So in just 8 years since this was born and done in 9 countries around the world, Philippines was the latest to join. You'll be surprised, there are now 30,000 facilities all over the world which are part of the Challenge Initiative. There are now 20,000 master's coaches, that are available. In fact, the government of India has adopted the concept of master's coaches as part of the entire government strategy. So they're recruiting their own equivalent of master's coaches. It has won out of more than 300 applicants for the worldwide competition on the best public-private sector partnership in the world, to be awarded in 2024 by the US State Department. Challenge Initiative won it. It is considered by the US State Department as the most successful partnership, public-private partnership in the world. And this was out of 300 applicants, And just recently, at the World Conference on Digital Health, TCI again won the #1 honor, scaling for digital health. This was awarded in Portugal. There's so many other awards, but I just want to highlight these two to show to you that all of you are part of something that is revolutionary that is happening in the world today, led by the local governments. By the way, and I will stop soon, the contribution of the local governments all over the world on family planning alone is about estimated at close to $100 million. Cash, no in kind, just cash. And if you include the health system support that the local government allocated in relationship to Challenge Initiative, you multiply that by $300 million. So that shows that the local governments are taking up the leadership, and we, the Zwilligs, the Gates Institute, the Bayers, and other supporters of TCI around the world are just here to help you. Thank you very much for this opportunity. to be present today, and I hope I meet the mayors before I leave, which is tomorrow morning. Thank you.
Thank you, Sir Oying, for setting the atmosphere for today's fruitful discussion.
Now, to provide us with an overview of the current reproductive health landscape in our country, we are pleased to welcome Dr. Anthony Faraon. Dr. Tony brings extensive expertise in public health and reproductive health programming as a Chief of Party for the Challenge Initiative Philippines. His leadership has been instrumental in advancing evidence-based reproductive health interventions across multiple regions.
Ladies and gentlemen, please join me in welcoming Dr. Anthony Faraon.
Good morning, everyone. Thank you for joining us today. It is a privilege to be surrounded by city leaders, partners, and advocates who have dedicated themselves in advancing reproductive health and, of course, empowering our young people. My topic is reproductive health landscape in the Philippines. It is both a story of progress and unfinished work, of promises made, promises kept, and promises that still need to be fulfilled. 13 years ago, in 2012, the Philippines took a historic step forward with the passage of Republic Act 10354, or the Responsible Parenthood and Reproductive Health Act. It was a breakthrough moment, a declaration that every Filipino, especially the poor and marginalized, should have access to the information and services needed to make informed reproductive health decisions. The RH law promised universal access to contraception, fertility control, sexual education, and maternal care. It represented hope that no woman would die giving life and that no young person would enter parenthood unprepared. But as we stand here in 2025, more than a decade later, we must ask ourselves, have we truly fulfilled that promise? According to the 2024 Census of Population, the Philippines now has 112.7 million people, up from 109 million in 2020. But the bigger story is this. Our annual population growth rate has slowed to 0.8%, down from 1.6% in the previous census period. This slowdown reflects several interlinked factors: declining fertility, fewer births, changing family preferences, and the lingering demographic effects of the pandemic. It also suggests growing awareness and access to reproductive health services in many areas, although access remains uneven. Our task now is to understand this demographic shift, not merely as a statistic, but a signal of broader social and health transitions that demand both innovation and equity. Nowhere are these shifts more significant than among our young people. In 2023, there were about 1.4 million live births registered in the country. Of these, 9.8%, or 142,000, were born to adolescent mothers aged 19 and below. The majority, about 9.6%, were among those aged 15 to 19. This represents a decline in adolescents' births compared to previous years, a sign that awareness campaigns, school programs, and local interventions are making an impact. But here's where we must sound the alarm. While births among 15 to 19 years old are declining, pregnancies among girls below 15 are rising. In 2020, there were 2,113 births to girls under 15, By 2023, the number rose to 3,343, a 63% increase in just 3 years. The Commission on Population and Development and the Department of Health have all warned that these are not merely numbers. These are children giving birth to children, often victims of abuse, poverty, or neglect. We cannot treat this as a small issue just because the percentage seems low. Each case represents a young life forever changed, a future interrupted too soon. So while adolescent pregnancy is a national concern, the risks are not equally distributed. Regions like the Bangsamoro Autonomous Region in Muslim Mindanao or BARM, the neighbor of Isabela de Basilan, which recorded the country's highest population growth rate at 3.43%, continue to face significant challenges in access to reproductive health information and services. In contrast, more urbanized regions such as Calabarzon, NCR, where 5 of our cities are located, and Central Luzon, where 2 of our cities are located, where nearly 40% of Filipinos now live, show slower growth and better reproductive health outcomes. This contrast underscores the unfinished work of the RH law, ensuring that services are not just available but accessible, acceptable, and equitable, especially for the poor and the young. So where are adolescents' births concentrated? Data from the past several years reveal consistent hotspots. The top provinces for adolescent births include Cebu, Bukidnon, Cavite, Pangasinan, and Bulacan. At the city level, the highest numbers are in Davao, Manila, Quezon City, Cebu, and Zamboanga City. These are not isolated or remote areas. They are urban areas. This tells us that proximity to health facilities doesn't guarantee access. The challenge is not only about infrastructure, it is about ensuring that services are youth-friendly, stigma-free, confidential, and truly inclusive. This is where the Challenge Initiative has been a true game changer. Through local leadership, systems coaching, and data-driven approaches, TCI has supported cities in scaling up high-impact practices and interventions that strengthen both family planning and adolescent and youth sexual reproductive health programs. These include immediate postpartum family planning so that every birth encounter becomes an opportunity for informed choice. Integrated outreach services, bringing family planning and AYSRH services closer to underserved barangays and hard-to-reach communities. And demand generation activities led by community mobilizers, youth advocates, and local champions to normalize conversations on family planning and AYSRH. These interventions are evidence-based, cost-effective, and sustainable. And they are precisely because cities have learned to institutionalize and fund them within their own systems. Today, as 9 TCI cities graduate from the program, join earlier graduates, we celebrate not just project completion, but systems transformations. City reform examples were narrated by Sir Austere earlier. These reforms are not one-off initiatives. They are sustainable changes supported by policies, budgets, and political will that outlast election cycles. But there is still much to do, and we must act with urgency and purpose. We are halfway through the current Philippine Development Plan, and we cannot afford to lose momentum. First, we must strengthen and harmonize our policies to ensure holistic, right-based approach to adolescent health and development. Second, we must invest in stronger data systems to guide actions where it is needed most. Third, we must mainstream family planning and adolescent pregnancy prevention in both national and local plans with clear accountability from the legislature down to the barangay. Fourth, we must expand FP and AYSRH facilities and services, not just in name, but in function, accessibility, and quality. And finally, we must address the root causes, ensuring that sustainable and comprehensive sexual education, youth participation, and economic opportunities give women of reproductive age group and young people the hope and choices for their future. The Reproductive Health Law gave us the tools. The Sustainable Development Goals remind us of our global commitment to ensure health and well-being for all ages. But these commitments mean little without implementation, coordination, and accountability. This is not just a government responsibility, it is our own responsibility. Parents, educators, health providers, faith leaders, local officials, and youth themselves must all be part of the DOH and CPD's call to adolescent health and friendly expressway for development. We cannot afford to fail our young people. They are not just a percentage on chart, they are 100% of our nature's future. As our population grows, our challenges shifts from managing numbers to improving lives. The gains we have seen in TCI cities prove that progress is possible with leadership, data, and community action aligned. But sustaining this progress demands consistency. Leadership that endures beyond election cycles, financing that outlives projects, and youth engagement that transforms beneficiaries into leaders. Lastly, the question before us is simple but profound. Will we act now with the urgency this crisis demands, or will we wait until the trends become irreversible? We in TCI believe we will choose action. We in TCI believe we will choose our children's future over complacency. We believe in TCI that together, through shared leadership, system strengthening, and compassion, we can ensure that every Filipino adolescent grows up healthy, empowered, and full of hope. Maraming salamat po. Congratulations once again to our 9 graduating cities. Proof that when leadership takes root, change becomes the norm. Magandang umaga po.
Thank you, Doc Tony, for giving us a clear picture of the reproductive health situation in the Philippines and reminding us why our work matters. Now, as we begin TCI's last graduation for the year, we are truly fortunate to be joined by our very distinguished guests from across the country. So let me briefly mention all of them now. First, Mayor Wilfredo Rex Oliva of Iriga City. Sir. Mayor Lina Montilla of Tacurong City. Councilor Shara Isabel Uy Salazar of Tagum City. Councilor Asan Al-Amin Kamlian of Isabela City de Basilan. Councilor Emilio Galarosa Jr. of Lapu-Lapu City. Councilors Ronald Alan Raimundo and Gil Costillas of Pasig City. From the Commission on Population and Development, NCR Regional Director Jacqueline Robel. Region 5 Director Joyce De La Paz. Region 9 Director Leticia Abao. Region 12 Director Desiree Gargarian. From the Department of Health, Centers of Health Development, Zamboanga Peninsula Regional Director Lenny Joy Rivera. SOC Surgeon Regional Director Aristides Tan. From the Department of Health Disease Prevention and Control Bureau, Family Planning Coordinator Dr. Marie Jasca Nicolas. From the Forum for Family Planning and Development, Vice President Dr. G.P. Perez. and Director for Programs and Advocacy, Kevin De Vera. From Wireless Access for Health, Executive Director Felipe Canlas. Again, from the Gates Institute, Sir Jose Oying Rimon. Sir. And of course, from Zwilig Family Foundation, our Chairman, Dr. Manuel Dairit. And our Executive Director, Sir Ostir Panadero.
And of course, we also like to acknowledge CPD Davao Regional Director, Dr. Jeff Fuentes. Thank you, everyone. Thank you to our distinguished guests for attending this important event. And for those watching us online, we hope you can stay tuned. We now move to the first major panel discussion. Family planning, demand generation, and service innovation will showcase how our cities have achieved remarkable improvements in modern contraceptive prevalence rate through community-centered approaches.
Moderating this session is none other than our Regional Manager for TCI Philippines, Dr. Alphonse Rafael Guevara. Doc Alphonse is a product of UP Manila, where he obtained his degrees in Basic Medical Services Intermed, Doctor of Medicine, and Master of Public Health. He has been actively engaged in various public health spaces for 5 years, providing services to rural towns as a doctor to the barrio and conducting leadership coaching to city program managers and co-developing policies and advocacy with regional and national partners as part of TCI Philippines. Let us call to the stage Dr. Alphonse Rafael Guevara and the Family Planning Panel.
All right. So good morning, everyone. And I'm sure everyone is excited for our first panel for today about family planning innovations. But before we start, we have a very interesting mix of participants for today. So it will be my pleasure to introduce you from across the country, our pioneers for family planning. Okay. So let's start with chronological tayo this time. No? So let's start with the first city, that one of the first cities that engaged with us today, the city of Tagum, which is represented by their Maternal and Child Health Division Head, Dr. Dinah Fajardo. Doc Dinah is a pediatrician and a public health leader who over 2 decades experience work in international NGOs, including the World Health Organization. She has since brought her passion for strengthening health systems and equitable health care to the mothers and children of Tagum City. So let us all welcome Doc Dinah.
Thank you, Doc Alphonse. Good morning, everyone.
Okay, next. Medyo malapit lang, no? Also hailing from the south, from General Santos, we have Ms. Judith Catalan Hanyola, City Population Management Officer. Si Ma'am Juday is a true-born daughter of Jensan who rose from the ranks and is now the City Population Office Manager. She is a population expert and she developed the population management strategy of the city. In fact, her thesis on the NGO-LGU collaborative approaches for FP implementation serves as the backbone of the strategy. So, magandang umaga po, Ma'am Judith.
Magandang umaga, maayong aga sa ato nga tanan.
Yeah, so talon naman tayo sa Luzon. One of our partners from the Bicol region, we turn to their city health officer from Iriga City, Dr. Ronald Pereña. So Doc Ronald has had many hats to fill. He's a medical technologist, an internist, a member of the Brotherhood of the Christian Professionals and Businessmen, and the Association of Municipal Health Officers, Bicol Region President. But now, he joins us to advocate for developing an honest-to-goodness health system that serves the community at large. So we're glad you can join us. Marhay nga aga, Doc Ronald.
Maray na aga man po, sir, and to everyone. Good morning.
Good morning. Okay. Medyo tatalon ulit tayo sa Mindanao this time. We go back to hear from Isabela de Basilan, represented by Ms. Bernardita Hontucan, Maternal, Newborn, and Child Health Nurse Coordinator of the City Health Office. So si Ma'am Penchi here has been a very experienced health professional with close to 3 decades experience working as the chief nurse of the Zamboanga Children's Hospital, a public health nurse, and the former chair and member of the board of the Philippine Red Cross. She embodies her compassion and commitment in serving the people of Isabela de Basilan. Buenos dias.
Buenos
Mapensi.
dias a todos from the happy city of Isabela.
Napapractice ang aking dito, no? Translation. And of course, our last, the latest to join us, but certainly not the least in terms of achievement, we turn to our friends from Lapu-Lapu City, represented by Ms. Ivy Amistad, Program Coordinator of the Safe Motherhood, Adolescent Health and Development, and Family Planning Program of the city. That's 3 programs in one. She has dedicated 25 years of public service, sharing her heart and expertise to strengthen the family health in the city of Lapu-Lapu. Maayong buntag, Ma'am Ivy.
Okay, it's a pleasure to be here. Though quite nervous, maayong buntag ka natong tanan. Magandang umaga po sa ating lahat.
Yan. So again, before we start, palakpakan po natin lahat ng ating mga pioneers and champions from across the country. So I want this to be a little bit more conversational. No? Let's make it more casual. Let's make it more informative. So I invite you to respond in the language that you feel most comfortable. I myself, magtataglish na lang po tayo, no? Opo. Okay, so this group of individuals is an interesting mix because not just geography, but chronology-wise, they came at different times during the project. So if you heard Sir Oying and Sir Ostier's background before, we started in 2021. That was just after the pandemic's height. And then we expanded further. And our cadre of presenters today joined at different points in the implementation of the program. So I think I want to set the scene muna. Let's go back to the unenviable time of 2021 and hear from the story of Tagum City. So Doc Dinah, you started with us 2021. That was still around the time of COVID, no? So what was the reality of the city back then? And how did you implement family planning during the time of pandemic?
Thank you for that, Doc Alphonse. Yeah, we started, or Tagum City started the engagement with TCI in 2021, where it was just after COVID, no? So during that time, we had low output or low distribution of supplies for family planning commodities. Hence, we partnered with TCI. So at that time, our modern CPR was 35%. And a lot of activities were going on since then with budget provided to the CLT or the city leadership team. And, but we highlighted some of our activities, rolling out our activities at the community and school level. So we developed our youth became leaders through Usapang Youth. So that's one. And then our men became champions through the Mr. God, or Men's Responsibility on Gender and Development, and PEGAD, or Parents in Education on Gender and Adolescent Health, sharing the family planning into a shared responsibility among the families. So from then on, for 5 years, our modern CPR became 45% from 35% in 2021. That's it.
Okay, so that's a change from 25% to 35%. That's almost 10% increase. And they continue to deliver the services even during pandemic. I'd like to hear also from the other pandemic batchmate. Ma'am Juday, same question. What was the landscape back then during COVID?
Well, initially the reality is in 2021 we've got 31% in modern CPR. In 2022, it went down to 25%. So we have all of those data generated, and our dilemma is the high number of individuals per household due to limited access to family planning kasi nga na-contain, and because also others are nahihiya po na lumapit sa ating service areas, no? And some are also migrants who just traveled here in General Santos City for a better living. And so we formed a policy. We crafted and enacted Executive Order 95-A, a series of 2023, and it is entitled the City Family Planning Itinerant Team, to serve as the city's technical working group on all concerns involving family planning, from service delivery to data accuracy, and cleansing also, no? That's basically the CLT itself. And it is composed primarily of the City Health Office. Of course, the head is here with me, also Dr. Elaine Calanza. And my office, the City Population Management Office. Also, the Dr. George Pireyeca City Hospital. And of course, the Office of the City Mayor. And the partner NGOs, specifically the Zulig Family Foundation and the Challenge Initiative and other partners, NGO partners. So our strategy is all about increasing awareness on knowledge of fertility and family planning, the methods, now of course, the regular conduct of Usapan Serye or series, and we offered long-acting methods and some permanent methods of contraception. Parang yun yung naging tinutukan ko talaga, specifically the non-scalpel vasectomy and the bilateral tubal ligation. And also we conducted demand generation activities during mobile outreach programs or activities at least every month. And facilities with City Health Office simultaneously done with health service delivery available on the spot or even on on-site visits to prevent missed opportunities among WARA. And we focused on home visits and conduct family planning needs to each household. And in 2021, once again, 31% in modern CPR. In 2022, it went down to 25%, and since it has soared to 34%.
So it went down because of the pandemic.
Yes.
But did it bounce back, the graph, the MCPR?
Yeah, but it actually nag-decline tayo.
Nag-decline,
Yes.
but you were able to bring it back.
I will bring it back to 34%.
So it's now 34% modern contraceptive prevalence rate.
Opo.
It's even higher than before the pandemic.
Yes, sir.
So
Tutok po talaga because
an
of
amazing story of recovery.
Thank you po.
Thank you so much. So they were able to persist even during pandemic. Actually, they were able to thrive even despite the pandemic. And I'll delve deeper later on the strategies, but I want to highlight that there's a lot of barangay involvement involved. You focused on the barangays and the youth. You focused on the youth, but also a neglected population, the males, the Mr. Gad and Pegad, which was directed to the parents and the males. It's a very interesting concept, Doc Daina. So let's go naman dun sa ating mga newer batches. So we expanded further after the pandemic. At around 2023, we accepted new members to join us in our new expansion areas. And one of the very first, I recall this distinctly because I was there, but one of the very first cities that joined us is the city of Iriga. So I'm very curious to ask this. Doc Ronald, you were one of the very first. So why did Iriga join in 2023? And what were you hoping to achieve during that time?
Okay, again, good morning, sir. With the initial reality, as you can see, Iriga City is a home of diverse communities. We have 21 tribes of IPs, so distributed within the 18 barangays out of 36 barangays. So, initial response, facing with reproductive health challenges and persistent cultural resistance in the need to reach out for women's and adolescent reproductive health, we've been looking for an entity or partner to to work with us to have a better strategy and then eventually harmonize our family planning. So that's when last July 2023, when we signified to join the Chalice Initiative. From then, we immediately approved the mayor in executed an executive order of Executive Order 20, Series 2023, which is the creation of the Iriga City leadership team. And then from then, we had the adolescent health ordinance from that year. So all of this anchored on inclusivity of Udama Matak, Udama Taga, meaning no one should be left behind. Everyone should be engaged. Everyone should be participative in looking for solutions in our problem. So from then, our MCPR was really inconsistent. Way back 2020, we had 40.61%. In 2021, we had 42%. The following year, 2023, we had 46.32%, and then followed by 39.99%. And then last year, we had 25%.
So it's dipping down.
Yeah, it's dipping down. But as you can see, sir, you don't have to look at it as a negative response. But because of our engagement with the TCI, that's the time that we were able to have a quality check with our data. So meaning to say, right now, we're so proud to have our accurate data. And it's now progressing again.
So you took the opportunity to clean the data, basically.
Yes, definitely, sir.
So even if it's 25%, you're sure behind the 25% you can count the individuals involved.
Yes, for sure, sir.
So it's their opportunity is to clean the data that's there, get a more accurate picture, and then go forward with their strategy. So thank you, Doc Ronald.
Thank you.
Okay. So next, another early joiner. Of course, very excited to join, and I was also there. So, Ma'am Penchi, can you recall ano naman yung story of Isabela de Basilan?
Yes, good morning everyone once again. For Isabela City, our initial report was family planning and reproductive health in Isabela City faced low awareness. We also have limited access to health services, particularly the indigenous people, the young adolescents, and the geographically isolated displaced areas. And we also have high FP unmet needs. So when we had the partnership with the TCI Israelic Family Foundation in 2023, immediately our city, our good mayor, issued an executive order creating the city leadership team. From there on, the city leadership team launched the first adolescent pregnancy summit in collaboration with the NCIP, IPMR, Ulama Council for Basilan, and the Madaris in Isabela City. Sila yung mga religious women leaders in Isabela City. So doon pinag-usapan teenage pregnancy, family planning in the context of Islamic, and other family planning champions, and same time the provision of family planning services during the campaign. And next is our SK Federation President, being a member of the city leadership team, also allotted our budget integration on the peer education sessions, and we are doing this on the Teen Hub in coordination with the Isabela Youth Development Office, the City Population Office, and the City Health Office. Yun din, yun ang ano namin, isa sa mga challenges we answered. And capacity building for the health workers. And we thank DOH9 for sending trainers because Isabela City is an island and we are under the administrative of Zamboanga Peninsula, though politically and geographically we are under BARM. And we are very happy because from that, na-train ang ating mga health workers together with on sexual reproductive health, usapang family planning in different batang bibo at saka batang ina, yan, batang ama at saka batang ina. And we are very, though the contracept, we are very aware of the baseline data on the contraceptive prevalence rate for Isabela City. We know that it is low. But with the interventions that we have done in the city of Isabela, intensified intervention, we have seen gradual improvement. Though it falls short for the national targets, but remain committed to sustain, institutionalize the program and the projects that we had for longer impact. And we aim to raise the bar in the family planning and adolescent health reproductive program for Isabela City. Thank you.
Thank you. So it's a very interesting mix kasi they are culturally diverse and also religiously diverse. No? So you have how many IP communities with your community?
16. 16 dialects. And we, by the way, we collaborated with NCIP for the IEC materials, translation of IEC materials for the social behavioral change. And let me mention, we'd like to, because Isabela City, meron siyang, yung sa PhilHealth, yung sa
Digitalization
of
electronic
medical records for Isabela City. We don't have that noon. When we are very happy with the partnership with the TCI. Sir Canlas is here. Hello, sir. With the TCI partnership.
Wireless access.
Ayan, wireless access for health. TCI, Zuelic Family Foundation, help us in the training of health workers for the wireless access for health platforms, and which help us which help us sa mga claims natin with the wireless access for health transfer in the PhilHealth e-claims for the digital health reimbursements. And from zero, we are now counting. Sir, millions. Okay, thank you very much.
Okay, thank you so much, Ma'am Penchi. We'll dive deeper dun sa inyong specific strategies, but so I'd like to highlight it's a very interesting mix of populations. That's why they had to do a very specified approach for each subgroup, for each religious group. Okay. So we'll dive deeper for that. But first, we hear from our latest member, who has only been with us for 2 years, but still, 2 years and already graduating. So I'd like to hear the story of how you accelerated everything, Ma'am Ivy.
Okay, good morning. Okay, I remember we have our first encounter with TCI ZFF in the year 2023. We were introduced about your business and usual approach and how our partnership with you will scale up in our intervention towards the implementation of the family planning program. So we submitted our expression of interest, which was then signed by our mayor, Junar Chan. And then afterwards, it was accepted. We made a program design, and it was also approved. So it was in January 2024 wherein we really have our proper engagement. Then our city leadership team was formed, and this team is composed of the mayor is the chairperson, but it includes the key stakeholders for the FPRP program and the adolescent health also. So it will include the LIDO, the SK, CSWDO in partnership also with DepEd, DILG, the two hospitals, and with CPD and DOH and CHO. So this team, it works on planning and implementation as well as the monitoring of the program, which our aim really is to reduce teenage pregnancy and as well as increase the uptake of family planning. But it was on June 2024 when we solidified our partnership with the TCI, when our mayor, then former mayor, signed the memorandum of agreement, memorandum of understanding, no, with the TCI, together with, or in the presence of the CPD, or the regional director of Region 7, the Commission of Population Development, as well as the Department of Health, and with ZFF, of course. Then after that, you try to capacitate us. You strengthen the leadership of our team through the health and leadership governance training, and also our health personnel, where they're trained about FPCBT 1 and 2 to further increase their competence, their skills and knowledge, and of course the right attitude on how to deal with the constituents and how they can deliver the services and avail it to the community. So because of TCI, we were able to generate demand generation activities, series of demand generation activities. They provide, or they help us for the technical assistance. They help us provide IUC materials, provision of logistics as well, and also in the process of making it really successful, several demand generation activities. As a result of those activities, the people in the community, no, especially the women, they're more aware that services are available in the health center, how they can avail it. And, but we should not forget that the role of the barangay health workers, they're the one who organize, who navigate, who make referrals to that center, so to explain them that such services existed. So they are our frontliners, and we're truly grateful to them. Because without them, the programs of DOH or our programs will not be implemented much.
So you dove deeper to barangay health workers. How did you capacitate the BHW?
Okay, we do comprehensive training. They have this basic reference manual, no? So that they can acquire the necessary skills also. Because they are our health promotion on the ground, on the grassroots level. So they serve the same community that they came from. So people trusted them. So we have to capacitate them. They have to be empowered.
So so you trained your BHWs, and I heard you were able to capacitate them. You had recently you were able to celebrate the National BHW Day.
Oh yeah, that's part.
How were you able to? What was the training involved? How did you capacitate them?
Well, with the technical assistance also from Department of Health, they have the module, no? Or what the trainings that BHW should undergo. So with that, we also improve them. We recognize them. We appreciate them. We let them celebrate the National Barangay Health Worker Day just to showcase the potential, because they also foster camaraderie. And we let them join the Barangay Health Worker Congress as well. They can receive updates.
Okay, thank you. And I noticed there's also another group here that focused on barangay health workers as demand generation advocates. No? So Doc Dinah, how about, you had a similar approach with the community power and innovation approach. So can you delve deeper? What's your version of health promotion for the BHW?
We are not really involved in the BHW, but as mentioned earlier, we we are using the Usapang Youth. No, the Usapang Youth sessions, usually these are youth who share their experiences as batang ina or batang ama, and also some of the mental health issues and HIV screening. So these are youth that they shared their experiences to the school, campus, or at the barangay level. So that's one, that's what we call Usapang Youth sessions. And another one, we have the male champions through Mr. God, or men's responsibility on gender and development, and the PEGAD, the parents' education on gender and adolescent health. So in these two activities, the men are more open now to talk about family planning or responsible parenthood. So they can share that usually through kainuman nila or sa mga motorcycle. Kasi most of the participants are, for the Mr. God, most of the participants are male. So mga motorcycle drivers, mga farmers, mga fisher folks. So sila yung mga participants. So at the same time, during their free time, they can talk freely on family planning or responsible parenthood. And for the PEGAD, the parents or the men usually, they talk about the education of their children and how they cope up with the growth being an adolescent. So that these are the two activities we have approach as our approach in the community level.
So two different flavors of demand generation or
Yes.
advocacy. You capacitated the BHW, so it's a more top-down approach, but still in the community. For Tagum naman, they capacitated the men to diffuse passively the acceptance of family planning in the community. So interesting that you both delve deep to demand generation, but you came up with different strategies that actually complement each other in a way. So it's interesting because the two I asked focus on demand generation, but there's also 3 more cities here who came to a different answer when we asked how to improve access. So for the case of, for example, Lapu-Lapu, they focused on direct outreach. Oh, General Santos and Lapu-Lapu, they focused on direct outreach. So how were you able to push through that outreach in the barangay? Jensen first.
Johnson first, Doc. Alfonso, thank you. If I may share with you, talagang grabe ang aking motivation to convince male clients namin for non-scalpel vasectomy, NSV po. And in fact, may isa akong nakakatuwang experience na umuo siya kasi 7 na ang anak niya. He's a Muslim actually. And umuo siya at na-surprise ako kasi rare yun eh. But talagang through my motivation, sumama siya. And in fact, nag-encourage pa siya ng iba. No? Because successful ang conduct ng kanyang NSV. And apart from that, we concentrated more on fisher folks kasi matagal sila sa laot. So pagbalik niyan talagang ibibigay ang lahat. So maraming nabubuhay. Kaya tumutok ako doon. Nakakatuwa, but it's really very parang fulfilling out of ilan ang na-motivate ko kasi meron kami katropa sessions and it resulted to at least 54 cases. Kasi this
All
is
fisher folk.
Mixed po yan.
Mix.
Meron po kaming bankers. I have motivated bankers to have that NSV and also male partners from the LGU itself or government agency. So lahat po. And yun po yung 54, I was so happy and na-touch ko yung life nila directly by coming up with
mobile. You provide
yes po,
mobile.
yes po. Ang NSV naman on-site po, pwede hong i-administer. Mas mainit, mas maganda kasi relax ang scrotum, and all of those. So that's one. And also we focused on BTLs also in partnership with, at that time, Maurice Stopes International. Kasi yun yung kanilang interest din po. No? So napakaganda po talaga if we have very close ties with NGO partners. And specifically for the, itong atin na po na business unusual approach, which covers also not only for the yung mature na, but specifically on the youth. No? Kaya malaki pong bagay ang naitulong ng the Challenge Initiative in addressing reproductive health issues natin and rights.
So actually, there's also another city, Iriga City, that also did the same. It's a mobile bababa sa barangay, do demand generation, and then offer the service directly. But you also partnered with an NGO, I think, Dr. Ronald. So can you elaborate how you did direct outreach in Iriga?
So then we recognize that addressing challenges, we need collaborative efforts with other partners. So by then, we had a partnership first with the DKT. Way back 2022, they are providing safe and affordable medicines for family planning commodities. And then it was followed with a partnership with the FPOP, which is the Family Planning Organization of the Philippines. So in doing community outreach in different barangays, they are our partners. And then thirdly, we had a partner with our POGs and Society of OBGYN. And then lastly, with the provincial office. We did a lot of joint family planning outreaches and mega health caravan. So from then, we were able to give more access to the community with regards to the family planning services. So eventually, really, it was really felt by the common tao.
So your direct outreaches, did you cover all barangays or did you specify the specific groups, the IP groups of Iriga for this approach?
Yeah, we have an piloting with the IPs, of course, since yun nga, medyo mga mahihain sila. So we really did an extra effort to really make them engage with our new approach. So, but then we also give services to other stakeholders within our city.
So it's interesting because AGTA, the IP of Iriga is AGTA, right?
Yes.
Okay. So what's the nuance? How different is it to do demand generation and direct outreach to the AGTA community?
So, you know, first and foremost, you have to gain their trust before you are able to proceed with your plan. And then we need to make them realize that we were really serious with them. And we tend to talk a lot with their leaders in the community, in their tribes. And then eventually we're able to, what do we call this one? Make one of their chieftain, we're able to understand the importance of the family planning. And eventually, siya mismo nagpalagay ng implant.
Nagpa-implant?
Yes.
The chieftain of the AGTA?
Chieftain, one of the chieftain of our barangay. If I remember it right, that's Barangay Santa Teresita. That's Chieftain Lumabe. So from then, nakita siya ng mga IP members, the benefits of that modern family planning. So it speaks for itself. Mas gumaan po ang effort namin sa pagpaliwanag, pag-convince sa mga kapatid nating IPs.
So you're able to involve the chieftain to be the role model, the champion.
Yeah, precisely.
Okay, that's very interesting. So normalization through addressing the key stakeholders of your IP groups. If you can get their buy-in and they get the support, they actually pull on more members to normalize the experience. So it's interesting because you have the AGTA, you have the Yakan, the Samabadjao. How different were you able to, because you also did outreach and demand generation with the IP. So how did you go about with your IPs in Isabela de Basilan?
Yes, for Isabela City, we didn't just focus on the IPs, but also the religious groups, the ulama councils, the madaris councils, and we trained them on the role on marriage during the first adolescent pregnancy summit. We do also include Muslim religious leaders during the PMOC, your pre-marriage orientation councils for Islamic marriage counseling. And one of the flagship for Isabela City is the health promotion. We are very lucky we have the local radio station manned by the LGU in partnership with the National Nutrition Council. We were given 3 slots, time slots for that, Bongga ang Isabela City. We have the FP on the go, Nutrition on Air, and Dapat Healthy para Happy, where we were able to give awareness information, this factual information to our constituents with reach of 3,000. So in different, not only for Isabela City, but as far as other neighboring municipality and even in some other barangays in Zamboanga City. You were able to diffuse it and in different languages, dialects also.
So I noticed you were able to translate the
Yeah, we
actual
do translation
material.
after materials to different dialects.
So how do
in
you,
partnership
how
with
do you
the local.
translate the materials?
Meron tayong mga experts on that. We partner with them. Tinutulungan nila kami for the translation of the materials for social behavioral change.
This is the NCIP?
NCIP, partner namin yan because we are kasama sila sa city leadership team and at the same time sa local health board team namin, kasama si NCIP.
So there were, you translated the material.
Yeah.
Why the need to translate the material? Why do you think it's important?
Because ang Isabela City, marami silang katutubo. They don't understand. They have to go down sa level nila para maintindihan nila what you wanted to impart to them. Thereby, we will have good outcomes, health outcomes with that. Maintindihan nila ano ang pinagsasabi natin, what you wanted to impart to them.
So there are
Merong
nuances
social
that you can
behavioral
only
changes din.
describe
Yes.
by going to the language.
Yes, yes. One of the greatest impact in mobile outreach and integration of family planning. Good thing with the launching of the Puro Kalusugan with the FP interventions in the 45 barangays. By the way, we have 45 barangays in Isabela City. Kasali si FP interventions and we have seen tumaas ang ating uptake and access for family planning.
Okay, so I think one curious question that I have, and I think a lot of you. How about the Muslim communities? Kasi there's a prevailing idea that there's resistance. How do you penetrate the Muslim community to deliver outreach?
In delivering the service, in delivering this outreach, mobile service outreach to these people, we partnered with the local community leaders kasi sila yung nagagay sa ating mga, they believe on them, community, local leaders, even the head of the family. So they believe on them. Ito muna ang tutukan natin.
So if you engage the head,
yes,
that's the chieftain or the
chieftain,
the imam?
The imams, even the women Muslim leaders, we already have that. We call them the madaris in Isabela. And good thing, our rural health physicians is para siya yung chairman, president on Isabela City.
Okay, thank you so much, Ma'am Penchi. So it's interesting because if you zoom out, no, we started the engagement with just the question of leadership. And we challenged all of our cities with just one question: how do you improve access? And they came up with different answers. Some focused on demand generation, like Tagum, like Lapu-Lapu. Go to the volunteers, get your BHWs, normalize the experience. Some went to the specialized IP groups, get your chieftain, get him to model, get her to model. Get your access the Ulama Council, access the tribal chieftains, normalize the approach on that level, and then deliver the outreach directly, like what you did. You delivered the demand generation and then orada dun din, no? Binigay nyo rin yung ano. So different versions, but there's a definite component of demand generation feeding towards service delivery. Okay. So one last question, I think, and I want to address this to everyone, because you have different flavors, but they're all very interesting ones. Now that you've heard from the innovations of each other, what do you think are you more interested in applying, and what do you think can you push further as a new innovation in your area? Let's start from Doc Ronald, going to Ma'am Penchi.
Okay, sir. After hearing all the strategies of my fellow panelists, I finally realized that though our strategy is effective in us, in our city, but eventually, if we can adapt all the good practices among the cities, we can for sure achieve faster and better. So we might as well collaborate all our good practices.
Why not? Why choose one when you can get all, no?
Yes, sir.
Sige po. So, Doc Ronald, Doc Dinah.
Okay, for Tagum, one of the challenges is to reach out the Muslim communities also. So, hearing from Isabella and also from Lapu-Lapu, it is good to collaborate with NCIPs for the material and whom to talk to when we conduct or talk about family planning. So it's more on the collaboration with NCIP.
So, in Davao, you still have the specific populations and you want to engage them. Okay. So, baka kausapin nyo na NCIP as member of CLT. Ma'am Ivy?
Yes, we learn from each other, but let me focus back to our barangay health workers that we have to sustain and develop them. And because they're very important in our local health system, since they are our frontliners. So we have to institutionalize or see to it they're being incentivized through including their budget in the annual investment plan.
Okay, so institutionalization naman of all approaches. If it's not in the budget, it doesn't exist. Sige po.
Well, in the case of Jensen, the key word for me is demand satisfied. So we need to really strengthen our mechanisms like reaching out the interfaith. No? Malaking bagay po iyon. And also, we need to strengthen also the partnerships with the policy makers para masundan at matutukan. And we need to really strengthen the social behavioral change natin. And kailangan aware ang tao na may health needs sila. And reproductive health needs rin nila. No? So, yun po yung akin. And we need to copy. If not, no, yung exchange of notes natin, we can replicate that to further strengthen our advocacies. Thank you.
That's a very interesting point, Ma'am Juday. You can copy, wala naman pong bawal. And actually, we encourage that. That's why we try to collect all those innovations. But at the end of the day, I agree, no? You need to satisfy the demand of the population. So, Ma'am Penchi, can you leave us with some parting words?
Yes, we have heard different strategies, pero ano yan siya? Isa lang ang target natin is to have better health outcomes for all the things that we've been doing. Again, overall, we have to strengthen teamwork because when we have strengthened teamwork with different agencies, different stakeholders, nagbo-boost yun ng confidence to work better as we envision ourselves for key results in the near future with the strategies that we've been doing or with the strategies that we have done. And yun talaga, strengthen teamwork with all our stakeholders. Thank you.
Thank you. Thank you, Ma'am Penchi. Again, thank you. Palakpakan natin ating mga panelists. So, we started with a question. How do we develop leadership? And how will you provide access to our constituents? They came up with different answers. They had different timelines. They had different strategies. They developed different innovations. But they all led towards one goal. And I'm sure you all agree here. It's to improve access to reproductive health and empower our families to make the decisions for themselves. So thank you so much, everyone. I'm sorry at this juncture that we cannot entertain questions, but we will provide an outlet online to satisfy your curious minds. But again, thank you so much, Doc Ronald, Doc Dinah, Ma'am Ivy, Ma'am Juday, Ma'am Penchi, and thank you everyone for tuning in.
Thank you, Doc Fons, and to our panelists for these enriching insights and very interesting discussion. No? Again, let us give them another warm round of applause. What we've witnessed here is truly remarkable. 5 cities, each facing unique challenges, yet finding innovative pathways to strengthen their commitments. We invite all our participants here in Park-In and online to send their questions through our form. Link and QR code are now flashed on the screen.
Your questions and comments will be collected and addressed by us and our city partners after the program. The insights will be summarized into one of our learning products, which we'll share after the event. Again, stay tuned and follow our official social media pages for updates. Now, we transition to a very special segment of our program. We'll be hearing directly from the leaders themselves, the ones behind these transformations. They'll share their personal narratives, the challenges they faced, the decisions they made, and the lessons they've learned in their journey toward innovative local governance.
Ladies and gentlemen, please join me in welcoming our first batch of distinguished leaders to deliver their narratives of leadership.
On behalf of Mayor Ray Uy, we are glad to have with us today Honorable Shara Isabel Uy Salazar, City Councilor of Tagum City. She is a dedicated public servant and experienced executive who earned a Bachelor of Science degree in Legal Management from the Ateneo de Manila University and completed leadership training at the Ateneo Graduate School of Business and the Asian Institute of Management. Councilor Uy is deeply committed to serving her fellow Tagumeños, her Higala. As chair of the City Council's Committees on Health and Science and Technology, she champions inclusive, people-centered health initiatives and sustainable innovation, dedicating her leadership to a healthier, more inclusive future for Tagum City. Let us welcome Honorable Shara Isabel Uy Salazar.
Maayong buntag sa atong tanan. Good day, everyone. I am deeply honored to share with you the story of Tagum City, how we turn challenges in family planning and adolescent health into opportunities for innovation, collaboration, and lasting change. Tagum, the vibrant capital of Davao del Norte, has always embraced progress. But with growth comes responsibility. Next slide, please. Next slide. Like many fast-growing cities, we face pressing concerns. The increasing adolescent births among 15 to 19, and the unmet need for family planning. There were also rising cases of adolescent pregnancies among 10 to 19 years old, and gaps in access to youth-friendly health services. In 2023, under Mayor Ray Uy's vision, we forged a partnership with the Challenge Initiative Philippines, Zwelig Family Foundation, the Department of Health Region 11, and the Commission on Population Development Region 11. Together, we ask, how can we bring reproductive health closer to our people, especially our youth and underserved families? From this reflection, we identified 3 priority gaps. First, the institutionalizing of the Population and Development Office to strengthen our systems on teenage pregnancy and adolescent reproductive health. Second, upgrading and expanding adolescent-friendly facilities. From only 6 barangay health stations accredited, we aim to cover all 23 barangays and upgrade our city facility to level 2. Third, training of more service providers at the barangay level to ensure every family can access counseling and family planning services. And the answer to these gaps lies in one thing: community power. Community power and innovations. We strengthen our city leadership team, bringing together local government, health providers, community leaders, NGOs, and private entities under one shared vision. In Tagum City, young people are not just beneficiaries, they are leaders. First, we empowered youth engagement through the establishment and strengthening of Teen Tambayan centers. The Tagum City Youth Development Office, under the City Mayor's Office, also has numerous programs that advocate youth participation and education. One of these is the SINAG Volunteer Organization, which now mobilizes 358 young volunteers, driving positive change in our communities. The Tagum Young Leaders Congress empowers 25 exceptional youth leaders each year in governance, innovation, and advocacy. And Usapang Youth, our adolescent welfare advocacy, aims to reach out to students, out-of-school youth, parents, educators, and communities in Tagum City through sharing of stories. We came up with this program around 3 years ago. I remember kasi when we were still kids, pag may mga may mga educators mag-goes to school and we showed a PowerPoint presentation, hindi tayo nakikinig kasi boring for us. So I was thinking, how do we make it more interesting? So we came up with why not we share stories. So our young storytellers willingly shared their personal experiences, from teenage pregnancy, depression, suicide attempts, drug use, being HIV positive, and so many more. Sila talaga po nag-volunteer na i-share nila ang kanilang stories. Narratives that were full of struggles but ended up as stories of hope. We believe that when personal stories are shared, our youth will realize that they are not alone in their struggles, in their experiences. We believe it will change perspective and outlook in life. It will inspire and motivate. We also made sure that men became part of the conversation. Programs like Katropa or Kalalakihang Tapat sa Responsibilidad at Obligasyon sa Pamilya, and Mr. God, Parent Education and Gender and Adolescent Development or PEGAD, trained male leaders on responsible parenthood, gender equality, and shared decision-making. And we amplified our advocacy through radio, social media, and IEC materials in our local dialect, ensuring no one is left behind. Awareness is only the beginning. Services must be accessible. That is why we institutionalized family development sessions. Next slide. We also launched the Service Caravan for Tagomeños, an annual outreach program that brings essential government services closer to our people by making it accessible and convenient. We put them up in the barangays, populated places such as our palengke and public terminal, retail establishments, schools, and private companies. Customized government services for different types of beneficiaries, including vital health services such as family planning, ligation profiling, and distribution of contraceptives, alongside other medical, legal, livelihood, employment, agricultural, and veterinary services, ensuring that quality programs reach every Tagomeño family. We trained midwives and nurses in long-acting contraceptives such as IUD and implants, and responded to rising HIV cases by offering free testing, making early diagnosis and protection available for the youth. We have invested in our people by uplifting the welfare and dignity of our community frontliners. Through the newly approved ordinances, the Enhanced Child Development Teachers Code, the Barangay Nutrition Scholars Welfare Code, and the revised Barangay Health Worker Welfare Code, we have increased their benefits, improved their protection, and ensured that their dedication to service is met with fair and meaningful support. With proper training and mentoring, they now deliver not only services, but also dignity, empathy, and informed choice. Next slide, please. Next slide. And these collective efforts are bearing fruit. By 2024, Tagum's modern contraceptive prevalence rate rose above the national target. Next slide. Our adolescent birth rate dropped from 51 to 32 per 1,000 live births, surpassing national benchmarks. But more than the numbers, what makes this gain sustainable is this. Family planning is no longer treated as a short-term project. It is now a priority of the city, embedded in ordinances, budgets, and governance systems. And even if external support lessens, our commitment as an LGU remains strong. Our story teaches us this. Real transformation happens when leadership listens, when youth are trusted as leaders, and when every family has access to accurate information and quality services. Tagum City stands as proof that when communities are empowered, health systems are strengthened, and leadership is inclusive, we can reimagine family planning, not just as a health service, but as a shared responsibility and a pathway to a healthier, more empowered future. Personally, what drives me in supporting this advocacy is to help in providing answers to the questions my mother, a health advocate, asks parents when she talks about this topic. Sabi niya, it's up to you how many children you have, the quantity. The questions are this: are you able to give your children the quality of life they deserve? And equally important, are you able to give yourself the quality of life you also deserve? We dream of a Tagum where every family has the freedom to plan their future, where every adolescent has the knowledge to make informed choices, and where reproductive health is embraced as a shared responsibility of government, partners, and communities. On behalf of Mayor Reti Uy, I commit as your Counselor for Health to continue bridging leadership, to connect, to listen, and to work hand in hand with all of you to sustain these gains. Because at the heart of this journey are not just the statistics, but the lives and futures of the people of Tagum. Daghang salamat. May our story inspire more cities to take action. Salamat kaayo for choosing Tagum City as one of your beneficiaries. We will invest in people and believe in the power of communities. Thank you.
Thank you, Councilor Shara, for your thoughtful message and for highlighting Tagum City's commitment to health and innovation. Your insights remind us that what we are building through TCI is not a temporary project. It is a foundation for lasting systems that respond to people's needs.
We now move to another city leader. Representing Mayor City Jalia Turabin Hataman, we are honored to have with us today Honorable Asan Al-Amin Kamlian from the City Council of Isabela de Basilan. He chairs the City Council's committees on health, sanitation, nutrition, disaster risk reduction and management, and climate change. Though new to his elected office, he brings extensive experience in education, leadership, and public service, with a long history of advocacy in peace building and youth participation. He holds 3 master's degrees including a Master of Public Policy from Japan's National Graduate Institute for Policy Studies. Councilor Cam Lian is committed to resilient, inclusive, and people-centered governance, championing health, disaster preparedness, and sustainable development in his city. Let us all welcome Honorable Asan Al-Amin Cam Lian.
Thank you very much for that kind introduction. Magandang umaga po sa lahat. Assalamu alaikum, greetings of peace. It is an honor to represent our Honorable Mayor, Mayor Siti Jalia Turabin Hataman, and the City of Isabela. Now let me begin with a simple picture. Imagine a young Isabelena, 15 years old, sitting quietly outside her school, and she's full of questions about her body, her future, her dreams, but she doesn't know who to ask. Around her, life moves fast, expectations are heavy, and choices feel limited. Now imagine that same girl months later, standing before her classmates, confidently speaking about reproductive health, about delaying early pregnancy, about finishing school, and about hope. She has become a peer educator, a leader, and a voice for others. That is the kind of transformation we dream of, not just for one girl, but for every young Isabeleño. And that dream is what drives us to make Isabela City a city that is so diverse in terms of culture and religion, but united as an adolescent-friendly city where young people are protected, informed, and given the space to thrive. At first, it was just a vision, but that vision grew stronger as our journey expanded, when we found the right partners who believed in the same future as we did. One of those key partners is the Challenge Initiative, a program that sets things into motion, building local capacity, ensuring that the changes we make are sustainable and community-led. Together with the Commission of Population and Development Region 9 and the Department of Health Region 9 and our local champions, we began to build a system that puts people at the center of our service. Because our vision is simple: a city where every young people is empowered, responsible, and fully engaged in decisions about their health and future, supported by good governance and a culture that lifts them up. Before joining the TCI, our city faced difficult realities. Our adolescent birth rate stood at 36.41 in year 2020. Despite improvements in recent years, the numbers remained alarming. Access to reproductive health services was limited, and our modern contraceptive prevalence rate hovered around 22%, showing that many families still lacked information or access to care. We also worked with modest resources. Only a few physicians and health workers serving all 45 barangays in the city. Our systems was fragmented and each of the offices were operating in silos. Our data is incomplete and our young people lack safe spaces or mentors to turn into. But every challenge, we saw opportunity to rebuild our systems, strengthen our health programs, and most importantly, give our youth leaders stronger voice in shaping their own future. Our change began with leadership. In 2023, we joined the Challenge Initiative, and soon after, through Executive Number 005, we created the City Leadership Team. It is a unified body aligning efforts on family planning and adolescent health. We listened to communities, studied the data, and designed programs that reflect real stories. A major milestone came with our adoption of the Wireless Access for Health platform, our new electronic medical record systems that now enable real-time data analysis, PhilHealth e-claims integration, and improved tracking of family planning and counseling services. For the first time, our health decisions are guided by timely and reliable data. We also aligned with Republic Act number 11596, which prohibits child marriage, protecting our girls and giving them the chance to grow, learn, and lead. In 2024, together with our partners, the Challenge Initiative, the Zwillig Family Foundation, and CPD9, we held the first Adolescent Pregnancy Summit during our Indigenous Peoples Month with the theme, Empowering Leaders, Indigenous Voices in Adolescent Pregnancy Prevention. We open spaces for faith leaders, IP youth, and advocates to speak up with courage and compassion. Our local Youth Development Office and the Sangguniang Kabataan Federation brought these advocacies closer to the grassroots, supporting adolescent-friendly health facilities and school-based teen centers, especially in IP communities such as in Malamawi Island. And because real progress requires real investment, we increased our gender and development funds for family planning and adolescent health year after year, from less than 1 million pesos in 2023 to over 5 million pesos in 2024, but having an expenditure significantly beyond that. That demonstrates our prioritization to reproductive health. Today, Isabela City is beginning to transform. Our adolescent birth rate has gone down to 32.35% in 2024, meaning more girls are staying in school and more young couples are planning for their future. Our modern contraceptive prevalence rate rose to 25.28, showing that families are making informed choices. We now have 19 adolescent-friendly health facilities and 40 trained postpartum family planning providers across the city, where before we only had a handful, and our health management information system is now fully operational, giving us data that truly drives impact. And perhaps most meaningfully, we have trained youth leaders and peer educators who are turning advocacy into action, inspiring others to follow their lead. These are not just numbers. They are stories of progress, perseverance, and partnership. Each figure represents a young person with a second chance, a family with a new hope, a community that chooses health and empowerment over silence and stigma. That's the journey we've been on, and it's the journey we share with all of you. Because somewhere in our city right now, there is a teenager girl folding away her school uniform, not because she wants to, but because early pregnancy forced her to stop. And there is a young couple unsure of how to plan their future, and parents who wish that they had the right words to guide their children. These are not statistics. These are lives, and they remind us as why we must keep on going. But today, the story is changing. With the systems we've built, the partnerships we've nurtured, and the leaders we've trained, we are rewriting that story. One conversation, one youth center, one empowered teen at a time. We believe in an Isabela City where young people don't just survive, but they thrive. Where they finish school, choose when to start a family, they speak up and they feel safe and know that their city and their partners are behind them. Because true progress is not only about infrastructures or statistics. It's about giving people, especially the youth, the voice, the tools, and a space to live their lives fully. We are not just imagining that kind of Isabela City. We are building it, and we are building it together. Thank you very much. Wassalam, and it has been an honor to represent our good mayor, Mayor City Jalia Turabin Hataman. Magandang umaga po.
Thank you, Councilor Asan. Indeed, the complex challenge of teen pregnancies we face require leadership, not only leads, but believe in change. And we will try to save and empower one teen at a time.
Up next, we have another leader and dedicated health practitioner, Lapu-Lapu City's very own Doktor ng Bayan, Councilor Emilio Galarosa Jr. Honorable Emilio Galarosa Jr. from the City Council of Lapu-Lapu chairs the Committees on Health and on Anti-Drug Abuse and Drug Trafficking. A proud graduate of Veles College and a licensed medical doctor, he champions policies and resolutions that advance public health, welfare, and community development. Beyond his work in public service, he continues to pursue his passion for medicine, serving patients as a general practitioner at Mactan Doctors Hospital, ARC Hospital, and in his own private clinic. Let us all welcome Honorable Emilio Galarosa Jr.
To our distinguished guests and important personalities that was acknowledged a while ago, our distinguished colleagues, public health leaders, fellow legislator, valued partners, magandang umaga po sa lahat. Ngayong araw na to, we gathered here not only to talk about family, adolescents, youth health, but to affirm our responsibility to protect the future of our respective cities. In Lapu-Lapu, our youth are not problems to be solved. They are potential to be nurtured. And when we invest in their health, education, and empowerment, we invest the progress in every family and in every barangay. That's why the city government of Lapu-Lapu has embraced the Challenge Initiative, or the TCI, in partnership with the Zwillig Family Foundation, Commission on Population, and Department of Health. Through this collaboration, we are strengthening our capacity to deliver adolescents and youth-friendly health services, expand access to correct information, improve governance so that our policy are not only well-written, but truly implemented. What TCI unique in its approach? It does not impose. It empowers. It challenges LGUs like ours to step up, innovate, and sustain our own gains. Through TCI's coaching and high-impact practices, we are promoting responsible decision-making among families and young people, preventing early and unintended pregnancy, providing safe spaces where they can seek guidance without fear of judgment. This is not a health agenda. It is a development agenda. So ngayon, I want to share a story about our city, our beloved city of Lapu-Lapu. A story not just a problem we face, but of the strength and resilience we found by working together. Not long ago, Lapu-Lapu City faced a critical challenge, that was both silent and serious. Our vibrant city, known for its energy and dynamism, was grappling with a troubling trend: the rising numbers of adolescents murdered from 2020 to 2023. The adolescents' birth rate jumped from 14 to 23 cases per 1,000 adolescents. Family planning data did not accurately reflect the current family planning user, as women 50 years and those who no longer residing in the city were still reflected in the Field Health Service Information System. Hence, there is a sharp drop of the modern contraceptive prevalence rate, or the MCPR, when we remove this group from the database. Lapu-Lapu City has not reached the target from modern contraceptive rate from 2022 up to the present. We knew this meant young people and families were making critical decisions without sufficient information, resources, and support. Not all barangay health personnel were trained on adolescents' job aid or family planning competency-based training for long-acting methods. But this was never just about statistics. It was about the well-being of our youth and of our families. Young people face life without adequate parental guidance, vulnerable to peer pressure, while myths and misconceptions on family planning kept even willing families from seeking care. These challenges reveal one core issue: our communities lack trusted, accessible, and judgment-free reproductive health information and services. We knew we couldn't just stand by and watch. It was our responsibility to act. We recognized that to solve this problem, we had to look to the heart of our community. That's why we partner with the Challenge Initiative Philippines and other government and non-governmental organizations to create a comprehensive and a community-centered strategy. We started by reframing the conversation. We shifted our message from just talking about contraceptive to embracing the bigger idea of responsible parenthood. We made it clear that the family planning is not about using contraceptive, but about empowering to achieve their goals through responsible parenthood. At the center of this new approach, our barangay health workers, our community's champion. These dedicated men and women are our most trusted health messengers, living in their neighborhoods, speaking their languages, understanding their unique concerns on the first hand. The barangay health workers are the barangay health educators and promotion officers. They go house to house, debunking myths and connecting families to barangay health center to get the care they need. The barangay health workers are trained to provide confidential and non-judgmental support, ensuring that every young person, women, and family feels respected and cared for. Their commitment has been exceptionally that they've been recognized as a PBI champion, or the performance-based incentive champions, a testament that they exceeded expectation when it comes to meeting performance indicators and providing quality service to the community for the entire Region 7. We strengthen our health system by investing in our people, training more providers in underserved barangays, ensuring access to the full range of contraceptive options, and equipping them with the adolescents' health skills rooted in confidentiality and non-judgment. We also invest in our barangay health workers, giving them the support and professional growth that they deserve. The results are beginning to show. Adolescents' birth rate have started to plateau, stigma has lessened, and more young parents now seek prenatal and maternal care without fear. This progress proves that when we empower our frontline workers, embrace data-driven leadership, and commitment dedicated financing, we create a lasting changes. Lapu-Lapu City Journey is a proof that when we put our people's well-being first, we not only improve health outcomes, but we build a future where every young person can make informed choices and every family can thrive. So, in behalf of our beloved, ever dynamic, active mayor, I am honored to represent our beloved city of Lapu-Lapu. Magandang araw po sa lahat.
Thank you, Councilor Emilio, for reminding us that behind all these numbers are real people trying to achieve their dreams and making their own choices.
For our last speaker for this batch, we hear from one of our most active supporters, the Mayor of Iriga City, Honorable Wilfredo Rex Oliva. Mayor Rex is a man of people, rising from the ranks of government from Kabataang Barangay and Kagawad of Barangay San Francisco to then becoming Liga ng Barangay President, City Councilor, Provincial Board Member, Vice Mayor, and now Mayor of his beloved Iriga City. He has been the recipient of multiple awards on exemplary service, and under his leadership, Iriga has likewise achieved accolades such as Seal of Good Financial Housekeeping, Child-Friendly Local Governance, and Good Local Governance. This passion for serving the underserved is one he brings even to our program. Let us all welcome Honorable Wilfredo Rex Oliva.
Diyos Marainaldo po, kaninyong amin. Our way of saying good day to all, invoking God's presence. In Iriga City, a guiding principle shapes every decision. Ida mawatak, ida matagak, or no one is left behind. This is more than a slogan. It is a commitment to ensure that progress reaches every family, from the city center to the farthest barangays, from farmers to indigenous communities. Known as the Conscience of Bicol and City of Springs, Iriga was inaugurated as the third city of Bicol on September 3, 1968. It spans 16,712 square hectares with 36 barangays and a population of 115,306. Our economy centers on agriculture, trade, commerce, industry, and ecotourism. Multiculturalism runs deep. Around 12,000 people, indigenous people, from 21 tribes situated in 18 barangays. Guarding our heritage, yet historically left on the margins of development. From the time I assumed office as mayor, I committed that no one would be left behind, ensuring IP families have a voice, access to health, education, livelihood, and respect. This is not charity. It is justice and equity. Inclusivity must extend to youth because Iriga's future depends on them. Before 2023, the city faced urgent challenges. Adolescent pregnancies were rising sharply, with adolescent birth rate increased from 1.91% in 2020 to 4.83% in 2022, while modern contraceptive prevalence fluctuated. Health resources were stretched. Only 3 physicians, 22 nurses, 22 midwives, and overstretched barangay health workers serve our population. Maternal services improve, but adolescent reproductive health lag. Stigma, distant services, and fragmental local implementation left many young people vulnerable. My response to these realities is deeply personal. My journey as a public servant began in 1985 as kabataang barangay councilor, barangay kagawad, kapitan, provincial board member, vice mayor, and eventually my present position. All public service office that I held are grounded and seen the plight of common Irigaeños. Early experiences in my native barangay, San Francisco, witnessing children running barefoot and young mothers carrying babies in fragile homes taught me that poverty is not just lack of money, it is lack of opportunity, choices, and hope. Policies alone cannot change lives. Services must reach homes, hearts, and minds. This conviction has guided me ever since. We knew that addressing adolescent pregnancy and improving reproductive health required more than budgets or policies. It demanded innovation, partnerships, and courage. On July 23, 2023, Iriga City joined the Challenge Initiative. Assessments by TCI and the Swilig Family Foundation confirmed our potential to implement high-impact practices for family planning and youth health. We strengthened leadership through Executive Order Number 20, Series of 2023, creating the City Leadership Team, whose composition involves KLGU offices and national government agencies and other stakeholders. Listening came first through consultations, barangay dialogues, and youth and IP engagement. We identified priority solutions. On September 30, 2023, we formally joined TCI's Next Gen cohort with the signing of a Memorandum of Understanding. Present with me were DOH Representative Dr. Ray Millena, RD Joyce de la Paz Silvano of Commission on Population Development. She is here. Our City Health Officer, Dr. Ronald Periña, Mr. Glenn Bed Benablo, former TCI Chief of Party, and our City Leadership Team members are present today. Guided by evidence-based high-impact practices, we prioritized post-pregnancy family planning, mobile outreach services, community group engagement, adolescent-friendly health services, and health leadership and governance. Together with Swilig, CPD, DOH, Pag-asa Youth Association, and Sangguniang Kabataan, we expanded youth-friendly services, introduced peer-to-peer counseling, trained health staff in cultural sensitivity, built referral systems through the information system on delivery network, integrated comprehensive sexuality education, and scaled mobile family planning services to remote and indigenous people communities. City investments match commitment. Maternal care and family planning budgets rose from 601,643 in 2022 to 2.27 million in 2023, alongside widespread capacity building and strengthened governance through the local health board and field health information system. Signs of transformation are clear. Services once distant are now accessible and welcome. Adolescent birth rate declined from 28 to 13 per 1,000 live births from 2020 to 2024. Demand satisfied for family planning rose to 58%, and the city's race, or the reflection and action to improve self-reliance and effectiveness score increased from 61% to 96 from 2022 to 2025. These numbers mean more young women staying in school, more families planning their future, and a healthier, inclusive Iriga city. This journey is far from over. Real change is about transforming people, leaders, and communities. In Iriga, we have shifted from top-down approaches to participative, consultative, and inclusive governance, listening, engaging, and valuing every voice. Guided by Ida Mawatak, we continue building a city where every young person in every barangay and culture can grow healthy, stay in school, and dream with hope. The work is ongoing, but momentum is clear. Through shared vision, strong partnerships, and unwavering commitment, we are breaking cycles of early pregnancy and inequality together. Diyos mabalos po, maraming salamat. The Challenge Initiative, Arriba, Iriga.
Now, we move on to panel 2, which addresses one of our most critical and sensitive challenges, adolescent pregnancy prevention and sexual reproductive health. As we have heard from Dr. Tony earlier, our country faces significant challenges with adolescent birth rates. But we will see in the next hour that these challenges are not impossible to overcome. Our panel cities have developed innovative, right-based, culturally sensitive approaches that are showing real results.
Let me introduce our moderator for this afternoon session, though she needs little introduction to many of us in the field of adolescent health. Since 2023, Dr. Dorilyn Balanova has been serving as the project director of the expanded Youth Leadership Governance Program implemented in partnership with the United Nations Population Fund. Before this, she led the Challenge Initiative as Chief of Party from 2020 to 2022, guiding cities and local governments in scaling up evidence-based family planning and adolescent health programs. A physician by training, a doctor to the barrio, and a passionate advocate for local health systems, Dr. Dori brings with her a wealth of experience from government service, academia, and development work. She has dedicated her career to strengthening health systems, improving maternal and child health outcomes, and advancing youth leadership in governance, consistently demonstrating her commitment to building healthier, more resilient communities. Please join me in welcoming on stage the ASRH panel moderated by Dr. Dorilyn Balanova.
Thank you very much, John. Good afternoon. Magandang hapon po. Sana po'y gising pa din kayo. Medyo malamig lang po, ano? Sige po. So, I'm really excited and honored to be here today. Kasi po, as mentioned, ako po yung kasama sa nag-start. So, noon, baseline and advocacy. And this time, marinig na natin ano na nga ba ang nangyari. And bigatin po yung ating panel. So, let me introduce them one by one. So, with us today is our Dr. Camille Almodiente Mascardo. She's from Mandaluyong. She's been a public health advocate since 2018. And she currently serves as Mandaluyong City's Adolescent Health and Development Program Medical Coordinator, leading youth-centered health education and service innovations. She also heads the Makabayan Health Center, balancing clinical duties with advancing community health. Dr. Mascardo helped establish the city's Population and Development Office and strengthen its service delivery network, ensuring coordinated, responsive care. Her leadership extends to key initiatives on HPV immunization, maternal and child health, nutrition and mental health, reflecting her strong commitment to improving adolescent well-being and building healthier communities in Mandaluyong. Thank you for coming today, Doc.
Thank you. Good afternoon.
Yan. Also, we have from Quezon City, Mr. Brian Cesar Asiatico. Nako, madami po ang ano nito. Juris Doctor Graduate, Licensed Psychometrician, Professional Teacher, Environmental Planner, with a master's degree in Government Management. Hindi, ano? With nearly 2 decades of experience in local governance, he has served both the legislative and executive branches of the Quezon City government and now serves as the Supervising Administrative Officer at the Quezon City Health Department. So Brian has helped craft landmark ordinances on adolescent health, mental health, and gender equity. A steadfast advocate for ethical and inclusive governance, he believes that truly healthy cities are built on systems that listen, include, and empower communities. Welcome to the panel, Mr. Brian.
Welcome po, ma'am. Salamat.
Next, we are honored to introduce Mr. Mark Ernest Ferrer, a dedicated public health nurse with over 14 years of service at the Pasig City Health Department. His expertise spans family planning, adolescent health, disease prevention, and emergency response. From 2011 to 2019, he was part of the community health education team, and during the pandemic, he led Pasig's COVID-19 OPSEN, managing hotlines and ambulance dispatch while earning certification as an international emergency dispatcher. Now serving as Nurse 4 and mental health nurse supervisor, he also leads adolescent and leprosy programs, trains on gender sensitivity, and actively advances FP-AYSRH with TCI. Magandang hapon, Mr. Mark.
Magandang hapon po.
And last but not the least, we welcome Ms. Gina Ramiscal. She's a dedicated public health leader and nurse 3 at the Tacurong City Health Office. Siya po yung pinakamalayo ang nilakbay among our panelists. So beginning her career in 1993 in the private sector, she transitioned to government service in 2008, where she has since become a driving force in maternal, child, and reproductive health. She has strengthened Tacurong's family planning and adolescent health programs, co-led the certification of 24 barangay facilities, and advanced immunization and FHSIS initiatives. Today, As City Coordinator for Family Planning, she continues to champion quality, accessible services for women, youth, and families across Tacurong City. Maraming salamat sa pagpunta, Miss Gina.
Hello. Good afternoon, everyone. Thank you, Doc.
Ayan po. So, makikita po natin today na each of the city has unique challenges, no? When we talk of AYSRH. And yet together, pag binuo po natin yung mga good practices nila, makukuha natin yung complete approach, no? From compassion to policy, from systems to speed. So, pakinggan na natin sila. We'll begin with exploring ano ba yung mga ginawa ng Mandaluyong City. Kasi, etong city na to, they recognized a gap that many cities could have overlooked. And with that, na-prevent po nila yung kanilang teenage pregnancies. Mamaya ipapakita po na itong, or nakita nyo siguro sa labas, na yung kanilang adolescent birth rate ay much lower than the national average. Kasi po yung national average ay 24 per 1,000, no? Young girls. Pero ito sa kanila, 19 yung umpisa nila, no? When they entered doon sa ating program. And in 2024, 13 na lang per 1,000. So, di ba? Anong meron sa kanila? So, pakinggan natin, no? How did Mandaluyong do this? Ano ba yung mga challenges, no, Doc, na nakita nyo, and how did you address this?
Good afternoon again. So, thank you, Doc Dory. So, our city have adolescents also that are vulnerable. They have layered vulnerabilities, such as problems in the family, stigma in seeking help, and most of the time migration, palipat-lipat, or most of the time there's no time to go to seek help. So yun. So we reframed the adolescent pregnancy in a way that it's not a moral issue only, but also a public concern that we should be more compassionate about, that we should also have a system that works together and be supportive to them. So our core approach here is one of TCI's major practices, which is community group engagement. So hindi lang kami sa adolescents nag-focus, which is dati ginagawa na rin namin sa Mandaluyong, but also we focus among the people who surrounds the adolescent. The parents, the teachers, and the barangay health officials or barangay workers po.
Yan, mukhang maganda yung binanggit nyo. Nagbago, no? Nag-shift ng mindset. Di ba? Yun yung umpisa. And it started with the health workers. And mukhang nahawa nyo ang community. Di ba? Kasi you were able to engage them. Ano, Doktora, yung mga examples, very specific examples ng community engagement that really worked, no? Best in dealing with our adolescent pregnancies?
Meron kaming two major activities that can be highlighted all throughout. Una, yung healthy young ones. It is usually done in the community, but over the past years, we have done this program under the DOH in partnership with the school's divisions office. So they are very open to conducting the training on healthy young ones to reach out to our young adults. Pangalawa is yung aming Adolescent Congress. I know in other cities they do this as well, but we do this year in, year out in our city where we have booths and lectures to help enhance their life skills and tackle their common issues and concerns po. So this year, medyo ginawa namin siya ng twist. It's not for all adolescents per se, but it's for all the adolescent mothers in Mandaluyong. We call it the Teenage Buntis Quiz B. So here, we did not only focus among adolescents, but among our adolescent mothers, who needs care and focus. So here we taught them about family planning, STI or HIV prevention, and maternal child and neonatal care po.
Yan, thank you, Dr. So ang na-pick up ko na bago doon, it's really working with the schools, no? Kasi before yung healthy young ones, diretso lang, no? Habang naghihintay sila, di ba? So hindi naman sila pumupunta, so hinanap nyo. So yun po yung maganda doon sa ginawa ng Mandaluyong. And siguro madaling gawin, no? Kasi city, malalapit lang yung lugar. How about kung malalayo, ano, dispersed yung ating populations, katulad ng sa Tacorong. Paano nyo ginawa such that ma-maintain nyo pa rin yung services and yung quality service at that? Ma'am Gina, can you share your experience po sa Tacorong City?
Okay, so good afternoon, Doc. Thank you, everyone. Totoo, Doc, yung una-una kasi, wala ang aming facility, hindi yan certified. Oo, hindi yan certified. So, anong ginawa namin? With the help of the TCI and the DOH representative, we initiated the certification of these 24 barangay health stations. And lahat-lahat yun, ginawa namin yung mga requirements, sinunod namin para lang ma-certify yung mga barangay health stations namin. So ngayon, Doc, yung aming 24 barangay health stations ay na-certify na yan. And this certification helps us to also build trust among the adolescents. Kasi pag walang trust yun, hindi yun magpunta yung mga adolescents sa inyo. So, yun ginawa namin at saka ngayon alam na ng mga adolescent saan sila magpunta, anong services available, and mayroon silang safe na safe space. And then, we also, Doc, prioritize namin yung capacity building ng aming mga health workers para alam nila kung paano mag-respond sa unique needs of this adolescent. Kasi yung adolescents, mahirap yan, hindi yan sila na madali lang kausapin. And next, we also capacitate our barangay health workers. Kasi sila yung unang makita ng mga adolescents. So, kung hindi nila alam kung paano mag-respond sa adolescents, so mahihiya yan. Oo, kasi sabi niya, baka ma-criticize sila, ma-discriminate sila. So, yun. Hindi yan sila. Kaya yun, nag-focus kami doon na lahat ng mga health workers ay ma-capacitate. And then we also have the adolescent service activities. So dito, nag-focus kami sa mga adolescents. So, kagaya na, for example, naganda kami ng Safe Motherhood Program activities, which directly focus on the couples, adolescent couples. And then, dito, matulungan namin sila kung mag-decide kung anong family planning ang kanilang gagamitin. And also, nagpartner kami ng POPCOM officer. Ano ginawa namin dito? Naglibot kami sa lahat-lahat na mga barangay health stations para ma-answer namin kung ano yung mga adolescent issues. And we also promoted responsible parenthood and improve their health-seeking behavior.
Yan. So marami kayong ginawa. Just for a better appreciation, ilan po ba lahat ng barangays nyo?
In Tacorong, we have 20 barangays, but we have 24 barangay health stations kasi yung iba malalaki na barangay. Kaya ginawa namin 2 barangay health stations.
Okay, so in each barangay, tapos meron pa na beyond yung Hindi siya 1:1 lang for bigger barangays.
Yes po, Doc. Yun ang ginawa namin.
Yes.
Para yung lahat na mga aming mga tao doon, masiserve namin.
So yung access no doon
Yes.
sa services and you ensure training
Yes.
doon sa inyong health workers.
Opo.
So beyond doon sa training, meron pang facilities mismo na na-establish doon sa Tacorong.
Yes po.
Sa loob po lang yan ng ilang taon po. May 1 year ba yan?
Actually, Doc, nung pagdating ng TCI, so nag-start na talaga kami kasi alam namin na ito makatulong sa amin. Kasi noon, Doc, noon nang wala pa yung TCI, yung aming mga adolescents, nakamix yan sa aming mga,
sa
mga
regular
patient.
na RHU.
So kung nakamix yan sila, ano pang ini-expect natin? Siyempre, hindi yan sila magsabi ng totoo. Hindi yan sila magsabi ng problem nila, di ba?
Yes.
Oo, kasi mahihiya man yan sila. Imagine mo kung may problema ka, magsabi ka, nag-iyak ka doon sa labas. Pagkatapos, paglabas mo, maraming tao nakatingin sa'yo, di ba?
Oo. So yun. So nainganyo sila because of that.
Apo.
No? Ito naman po, thank you no, for sharing. So, meron kayong tao, meron din kayong facility, meron din ang Pasig niyan. Pero ang naging problema naman sa Pasig, mukhang kanya-kanya, ano? They're working in silos.
Yes po.
So, paanong ginawa nyo doon, Mark, para ma-break yung silos na yan at saka yung mindset na akin to, akin yan, sa'yo yan?
First po, we apply po yung bridging leadership po. Yung owning the problem, co-owning the solution, and co-creation of boundaries po. Yun po. Then, nag-identify po kami ng mga issues. And mga issues na kung saan po, yung mga offices and departments po na concerned dun sa mga issues na yon ay hindi lang po basta sila lang po yung nakakaalam ng mga datos. Then, ini-eliminate din po namin yung kung may mga adolescent po na may problema, na ire-retell po nila yung kanilang traumatic experience from agency to agency na mapupunta nila hanggang mawala na po sila sa proseso and mapabayaan na po yung kanilang mga cases po. Yun po.
So maganda yan, no? So you decided to work together para sa ikabubuti ng ating adolescent. Hindi siya ipapasa-pasa kung saan.
Yes.
Yes. So you were able to build trust siguro, no? During the process?
Yes po.
Oo. So ano pa yung ginawa niyo para ma-build yung trust nila?
Yung ginawa po namin sa Pasig, we started po with collaborating with Sangguniang Kabataan and other youth organizations under po nila. Then we come up with communication planning kung saan po sila po mismo yung nag-create and nag-design ng information dissemination na kung saan po maiintindihan po ng mga adolescent yung kanilang, kasi since adolescent din naman po sila, maintindihan po nila yung ng kapwa nila adolescent, yung kanilang design na information dissemination about adolescent sexual reproductive health and other issues po na iano po ulit sa information dissemination.
Wow, so magandang practice yan, no? Hearing from them and letting them work with you, no? As partners, sila na rin yung nagde-design, sila na rin yung gumagawa, no? Para ma-disseminate yung proper information on AYSRH.
Yes.
And so parang naging aktibo as a stakeholder yung ating mga youth, tama ba?
Yes po. Actually po, may mga projects po ang mga SK regarding po sa ASYRH po. ASRH po. Ini-invite po nila kami, mga selected programs po na connected po sa adolescent health like mental health, substance abuse, HIV and STI offices po namin. Kung saan po nagko-conduct po kami ng health education po by groups or by small groups to big groups po sa kanilang mga community.
Wow. Ito ba'y bago sa inyo? Kasi when we started noon sa Mandaluyong, parang yun yung goal na mas maging aktibo at mas focused ang mga project ng youth leaders natin sa Mandaluyong. So ito bang mga sinasabi mo ay mga bago na nga ito na ginagawa nila?
Yung collaboration po with... nag-start po kami nung 2023 kung saan po kaka-elect lang po ng aming mga SK officials. Nag-conduct po kami ng isang activity po where to introduce po yung mga health program sa kanila para makaisip po sila ng projects regarding adolescent health po. And other health programs po na magbe-benefit po yung mga kabataan sa Pasig.
Yun. So, wala na yung Zumba lang, basketball lang.
Ayun po, yun nga po yung idiniin namin during sa procurement process po nung activity namin na hindi lang po dapat regarding sa sports, Zumba, yan sabi nyo nga po sa Zumba, dapat po more on health education din po. Ang maging project po ng sangguniang kabataan and other, pati na rin po barangay sa community.
Okay, thank you Mark. So nakita natin may programs, no, may initiatives ang bawat city. At ito naman sa Quezon City, naisip nila hindi lang dapat may programs. Dapat kung may initiatives tayo, i-sustain natin yan. And gumawa po sila ng policy, no? Ano ba, Sir Brian, ang nag-udyok sa inyo para gumawa ng policy?
Siguro ma'am, ang number one na ipinagmamayabang naman lawi namin is that Quezon City is a trailblazer when it comes to institutionalization of several policies. Even before the National Reproductive Health Law was implemented, Quezon City has it already.
Wow.
So marami na rin tayong mga bagong mga polisiya. Pero nung nakita natin na medyo may mga problema tayo, sabi nga natin, bagamat marami sa amin, siguro ang aming mga adolescent pregnancies ay mas mababa sa national rates, ay pinili pa rin namin makibahagi sa TCI at pinili pa rin ng Quezon City na mag-produce ng isang institutionalized adolescent pregnancy prevention ordinance because nakita natin na for adolescent pregnancy, one is too many. Kahit na isang adolescent lamang yan na mabuntis ng hindi nakapagpe-prepara or hindi handa ang kanyang katawan, ay that is too many already. Sa Quezon City, hindi ganun ang sitwasyon. Medyo mataas-taas din na nagsimula kami with TCI. Pero ang pinakamahalaga siguro dito ay nakita natin na dapat holistic. Dapat kainin natin yung buong sistema na pwedeng ipasok doon sa ordinansa at wala dapat leader na pwedeng sabihin na hindi niya i-implement ito dahil may batas na sinasandalan yung prevention ng adolescent pregnancy. So sa amin, sinabi namin na kailangan lahat ng kabataan involved. Sinabi namin na lahat, hindi lamang yung mga babaeng nabubuntis ang involved na bata, kundi ang kanilang magulang at ang mga kalalakihan. Kasi yun yung minsan na miss out yung participation of the male doon sa male adolescents doon sa whole situation. Another is the creation of the Adolescent Pregnancy Prevention Council. So mayroon tayong konseho na mga leaders na medyo na sila ang tumitingin pagdating sa polisiya, wherein the TCI helped us because of the CLT, yung ating training ng mga community leaders din, syempre the city leaders team natin. So naging malaking bahagi ang TCI dito sa paghinang pa at noong organization. Kaya kasama natin dito ngayon, even yung aming lead, ang ating CHO at sa Quezon City Health Department at even yung ating lead convener. Kasi tinignan namin, actually, ang maganda siguro sa Quezon City, hindi niya tinitignan na health issue lamang yung issue ng adolescent pregnancy. It is a holistic nga, sabi ko nga. Kaya nga ang lead team namin dito, ang secretariat noong council ay hindi health department, kung hindi ang Quezon City Youth Development Office. Kasi mas maganda na sa kanila magsimula mula sa programa ng mga kabataan, magkaboses mismo yung mga kabataan rather than sa mga matatanda. Sorry
Ouch.
Sorry, ouch ng konti na rin. Pero yun nga, hindi pa pwedeng hindi sila pakinggan. Hindi pa pwedeng hindi sila maging bahagi. Ito yung tinitignan ng ordinansa na kailangan dapat kabahagi sila sa pagbibigay ng boses. Yes, you have institutionalized it, pero kapag hindi mo ginawa na kabahagi sila nito, ay magiging baliwala lahat ng interventions sa kanila.
Yes, that's true. I agree, no? And nandoon na rin lang tayo sa policy implementation. Paano na-i-ensure ng Quezon City na na-i-implement nga yan? Ang laki-laki ng Quezon City.
Correct. We
How
have
do you do
142
that?
barangays. We have around 3 million population. We have more than 3 million population. So medyo malaki-laki talaga si Quezon City. Pero with the help of our health department, yun nga sinabi nga natin, hindi lang health department kasi yung nag-i-implement. We have other services offered by the various agencies. Pero sa health department alone, we have 59 health centers na certified as adolescent facilities. So soon, yung ating mga teen centers, teen health quarters natin ay magiging level 3 pa din. So again, with the help of DOH and other organizations, private and public organizations, mga agencies, tinatry natin yung best natin. At doon naman namin siguro naisitaas din at ilabas yung pangalan din ng aming mayor, si Mayor Joy Belmonte, na yung number 1 support niya doon sa programa. Sabi ko nga, sa kanya mismo nang galing na hindi siya papayag na may kabataan pa na nabubuntis. Hanggat pa pwede natin ma-save, hanggat pa pwede natin mapigilan yung pagbubuntis ng mga kabataan. Sa kanya lagi niya sinasabi yan sa amin, one too many. Kaya nga, in-implement din namin yung Quezon City BRO or yung Birth Registration Ordinance, one of the ordinances, na kung saan it is a data-driven birth registration ordinance na kung nakikita natin kung sino-sino ba on the spot, kung sino-sino ba mula sa pribado at sa pampublikong mga hospital or mga clinics ang nai-rehistro na mga kabataan na maagang nagbubuntis. Wow. So marami pang ordinansa, even the mental health ordinance ay kabarte nito ng mga pinapa-institutionalize sa atin ng ating mayor.
Thank you, no? And from that big city, mag-jump tayo sa Tacorong. How do you ensure na talagang nai-implement din yung inyong programa uniformly, na may quality talaga? Miss Gina?
Okay, Doc. So, to ensure that the quality was not sacrificed, no, we implemented the monthly visit and coaching all across 24 barangay health stations so that we directly know or kung ano problema nila and ma-answer namin kaagad. So, for example, we identified the barangay that needs demand generation para yung mga problem hindi madi-delay or ma-address kaagad. Kagaya ngayon, mayroon tayong tinatawag na purok kalusugan, Doc. So monthly, ina-assist kami ng aming DOH representative. Tinitingnan namin doon kung anong barangay or puruks ang dapat naming tulungan. Makita mo doon kung anong purok ang maraming teenage pregnancy, sino yung purok na mababa yung demand satisfied. So doon talaga kami nag-focus. And then next is we conduct regular data quality check. This is very important in data accuracy because our city had both local and migrant populations. So realigning with the DOH indicator, matatrack namin yung progress ng aming ginagawa. And kung hindi siya swak or hindi pa mag-change kami ng aming intervention. And also, finally, nagpapasalamat po kami sa aming Ma'am Julie and Sir Troy sa tulong. Oo. Kasi magagaling yun sila, Doc. Oo. Tinutulungan kami. Technical assistance. So sabi ko, Sir Troy, sana next year andito ka pa rin sa amin.
Ala. Di ka na daw uuwi.
Oo. Para matulungan kami. And rest assured ngang lahat na technical assistance and best practices na naturo sa amin ay gagawin namin o i-practice namin sa aming adolescent health services.
Yan, thank you. So, si Troy, baka nagtataka sila, sino ba yan? Si Troy. Siya po ay, kasama sa ating TCI
Yes
staff
po.
na assigned sa kanila.
Sa amin po.
So, na-mention nila, grabe, no? Tinitignan nila hanggang purok level. So, makita na gusto nilang mag-respond sa needs ng community as well as sa needs ng service providers. At kaya meron silang regular coaching, mentoring, at saka data analysis, which are very important. So, itong ating challenge sa adolescent pregnancies, kailangan din natin strike yung balance between taking care of the mothers, yung social protection sa kanila, but at the same time, also preventing subsequent pregnancies kasi ayaw nating mabuntis sila agad ulit, habang sila ay adolescents pa. Sa Mandaluyong ba, Doc Camille, anong ginagawa nyo para ma-prevent pa yung mga repeat pregnancies nila?
Challenging nga talaga. Very appropriate sa the challenge initiative. But finding the right balance is really the key. One of our key messages sa mga kabataan is they still have a choice. If you got pregnant, you still have a choice. You still have a future. So one of the things that we also improve among our trained health personnel and dun nga sa ating community group engagement natin is to train them to be more compassionate with the young generation or the young adults. To train them to be more non-judgmental and create a more safe space for them to make informed decisions na makagawa sila ng tamang decision in the future po. So with this, moving on, we want to continue doing activities that are more focused among our adolescent mothers, especially the teenage buntis quiz bee, but among that, yung continuous health services at saka gaya na nga rin ng sabi dun sa Pasig, holistic ito. So yung iba rin mga services, gusto namin continuously maibigay, hindi lang po sa health.
Yun. So talagang tutok doon sa mga nandyan na, and quality services yung ating gustong gawin para ma-prevent talaga yung succeeding pregnancies. And dun sa Pasig, nasabi na kanina, they're no longer working in silos. And narinig namin, maganda rin yung nangyayari sa inyong ISDN. And this is considered a rights-based and needs-based approach. Pwede mo bang mas maipaliwanag yan, Mark, sa atin?
Ayun po. Sa needs-based po, ito po, yung pang-araw-araw po na kinaharap nag-base po kami doon sa pang-araw-araw na kinaharap po ng mga adolescent. In reality po, doon po kami nag-base po sa needs-based. And para malaman din po nila na yung mga programa po na available po sa Pasig is nagre-respond po sa mga pangangailangan nila based po doon sa mga kinaharap nila sa pang-araw-araw and yung mga real issues po nila. Yun po yung sa needs-based po. Sa rights-based naman po, dito naman po nakasandal po kami sa mga national policies po kung saan po makakapagbigay po kami ng services na kung saan po napoprotektahan po yung confidentiality and privacy. Then nabibigay po yung services na without judgment and discrimination sa aming mga adolescent na pumupunta po sa aming mga health centers po.
And paano ito natatranslate sa, di ba may governance side yung ISDN? Ano ba yung particular halimbawa ng ginagawa ng ISDN to show na merong functional governance body as an ISDN?
Yung sa governance, ang nga po, di ba, ang Pasig po is kinikilala po ngayon for good governance.
Yes.
Yan. Hindi lang po basta kami sa pinapakita sa good governance dito yung financial transparency and efficiency po. Pinapakita rin po dito yung Sa pamagitan po nun, yung aming malalaman po ng mga kabataan or mga adolescents na meron pong tangible programs po na available po sa Pasig na kung saan pag humingi po sila ng tulong is matutulungan po sila na hindi na po sila matatakot na pumunta sa health center na dati na pong nangyayari yung stigma nga po ng pagpunta sa health center. Yun po.
And hindi lang isang department ito, no? Hindi lang health.
Yes po, marami pa po. Yung nabuo po naming team saan po, marami po kaming department na kasama, hindi lang po sa health, yung CSWD, Local Youth Development, Sangguniang Kabataan po, ayan po, kasama po namin yan sa tawag doon, para nagkama po kami doon sa ganung strategy po, para makabuo po kami nung tama at yung talagang kailangan po na nakapaloob po doon sa ISDN.
Okay, so thank you very much. Nakita po natin, no? From Mandaluyong, we have compassion and change of mindset para ma-deliver po yung ating responsive approaches. And then we also saw yung speed, kung paano ginagawa doon sa Takurong, no? And scale that they do para ma-reach agad lahat, no? At one time. And then nakita natin from Quezon City, dapat i-sustain to, no, with the policies that should be issued. And of course, we should collaborate, no, when we do this. Kasi hindi ito problema ng isang tao, but it should be a joint venture, no, whole of governance nga sinasabi natin para ma-solve ang ating problem sa adolescent pregnancy. So, pasalamatan po natin sila na ating mga panelists. Meron po ba tayong open forum? Ay, wala na. So, wala na po daw open forum. Kasi wala namang open forum. Any messages from anyone?
Siguro,
Yes.
siguro yun lang from the point of view of Quezon City lang rin na sana yung learning, the TCI, bagamat alam namin na kaparte kami ng mga graduate ngayon at sigurado na ito, bagamat mamaya pa yung awarding ng actual graduation. Pero ang aming pasasalamat sa TCI because of the fact na the whole 2 years that we're together with TCI, bagamat meron pa tayo, we are still under the pandemic then, ay
Yes.
na-support yung programa to the point that the Quezon City was empowered, particularly yung ating mga city leaders, was trained on how we could improve and how we could come up with actual programs in Quezon City. And I hope, yun nga, sana wag bibitiw. Sana wag bibitiw. Maraming salamat sa mga from Doc Alphonse to Ace and to the people who have helped Quezon City and the whole TCI team. Maraming salamat from Quezon City.
Yes, thank you, Quezon City, through Sir Brian. Doc Camille, you have anything to say? Or anyone? Sige, Doc.
I'd like to take this chance na rin po para mapasalamatan nga po ang The Challenge Initiative. You have encouraged our city to strive better. So if we were, I know we were doing our best before we have entered this agreement, but after this, graduating from this, we now know na we can do better. Thank you.
Wow, thank you. And Gina?
Okay, so nagpapasalamat po kami sa ng malaki sa TCI kasi marami talaga yung ay matulong niya sa amin. Rest assured, ang aming butihing mayor, very supportive mayor, andyan lang po. Mahal na mahal niya po yung TCI. Kasi sabi niya, yes, pinagmalaki namin yan kasi sabi niya, yung TCI talaga yung nagpabago sa kanya, yung pananaw ni Ma'am. So, mamaya sa speech ni Ma'am, malaman nyo kung ano yung ano na. And thank you so much.
Thank you, Miss Gina and Mark.
Siguro magpapasalamat din po kami sa The Challenge Initiative. Kasi po nung nag-start po kami, kala namin kami lang po hanggang matapos po yung namin sa TCI. Kasi po nag-start po kami with family planning, safe motherhood, and adolescent health lang po. Then with Office of City Councilor Consi Cory Raimundo po. Yun po yung start talaga. Then habang nagkakaroon po kami ng mga meetings, kada meeting po nadadagdagan po kami ng kasama. Yung na-identify po namin yung mga other programs and offices po na dapat po involved sa adolescent health. Hindi lang po kami nag-stop sa health. Pati po nakasama rin po namin ng PNP, barangay, mga barangay chairmans po, or yung ABC po, Association of Barangay Chairmans po. Then, to come up po, yung ginawa po naming ISDN, identify po namin yung real problems po ng adolescent from ground hanggang sa pinakataas po na ng aming city government, which is yung hanggang sa paggawa na po ng ordinances po. We try to make ordinance for adolescent, which is yung issues po ng teenage pregnancy and establishment of teen centers po. We try po, yun nga po, kahit hindi po maganda yung kinalabasan, pero may option pa rin po kami na pwede pa po namin magkaroon po kami ng mandate, ng policy regarding adolescent health.
Thank you. Thank you, Mark. So, let's remember, no, lahat ng senior nila actually, pwede rin nating pagsama-samahin sa ating mga syudad for, di ba, parang mas maximum yung effect talaga and we'll be able to improve pa yung ating current situation. So I'd like to close, just remember that adolescents are not problems to be solved. They are rights holders, partners, and co-creators of a better future. With that, thank you very much for listening. Thank you.
Thank you very much, Dr. And of course, I want to acknowledge our panelists for bringing such depth and candor to this discussion. We've witnessed cities confronting adolescent reproductive health not as an abstract policy issue, but as a lived reality affecting families across their communities.
The frameworks and outcomes we've examined tell part of the story, but they don't capture the weight of leadership required to champion these initiatives. Behind each successful program stands a leader who chose to prioritize long-term community health over short-term political comfort.
These leaders will take us through the pivotal moments and conversations that shape their perspectives, as well as the real-world challenges of advancing AYSRH in diverse communities. Please join me in welcoming our leaders who will share the authentic stories behind their city's adolescent health breakthroughs.
Leading our second batch of leaders and representing Mayor Menchi Abalos is Dr. Emily Detaro of Mandaluyong City. She serves as the Assistant City Health Officer, overseeing the implementation of key public health programs, including sanitation, disease prevention, and community-based healthcare. A fellow of the Philippine College of Addiction Medicine and a DOH-accredited physician for drug dependency, Doc Emily is a strong advocate for preventive health and wellness. Let us all hear from Dr. Emily Detaro.
Thank you po sa introduction. Yan po ang picture ko pag nag-workshop kami sa TCI. Anyway, sa ngalan po ni Mayor Menchi Abalos at ng pamahalaang lungsod ng Mandaluyong, isang mainit na pagbati po at pasasalamat sa inyong lahat na patuloy na sumusuporta sa ating advokasya para sa mas malusog, mas ligtas, at mas empowered na kabataan at pamilya. Sa Mandaluyong po, mahalaga ang bawat datos at impormasyon bilang gabay sa paggawa ng makabuluhang desisyon, paghubog ng polisiya, at pagtutok sa mga pinakakritikal na pangangailangan ng ating mamamayan. Sa nakalipas na mga taon, nakita nating makabuluhan ang pagbaba ng bilang ng adolescent pregnancies sa aming lungsod. Ito ay bunga ng mas pinatibay na family planning at adolescent sexual and reproductive health programs na isikanatuparan sa pamamagitan ng masinsinang koordinasyon ng aming mga barangay, paaralan, health centers at mga youth leaders. Nais kong ibahagi sa inyo ang Task Force Batang Ina at ang Teenage, Adolescent and Treatment Hub bilang mga inisyatibong bunga ng mas pinatibay na family planning at adolescent sexual and reproductive health programs ng lungsod ng Mandaluyong. Ang mga ito ay nagsisilbing haligi ng lokal na pamahalaan sa pagtugon sa mga hamon at maagang pagbubuntis at sa pagpapalakas po ng karapatan ng kabataan sa kalusugan at impormasyon. Ang Task Force Batang Ina po ay isa pong multi-sectoral approach na binubuo ng mga kinatawan mula sa health, social welfare, education, barangay at youth sectors. Ang layunin nitong magprotekta at gabayan at bigyan suporta ang mga batang ina sa pamamagitan ng case management, social interventions at reintegration programs. Ito'y nagbibigay ng access sa health services, counseling at livelihood training upang matulungan silang makabangon at makapagpatuloy sa edukasyon o kabuhayan. Ang Teenage Adolescent Hub naman po ay isang safe space para sa kabataan kung saan sila maaring kumonsulta, magtanong at makakuha ng tamang impormasyon ukol sa reproductive health. Ito ay pinatatakbo ng mga trained youth-friendly service providers na nagbibigay ng family planning, counseling, and adolescent health education at mga referral services. Ito po ay nagsisilbing sentro ng empowerment para sa kabataan upang maiwasan ang maagang pagbubuntis, mapalakas ang kanilang self-esteem, at maitaguyod ang tamang desisyon sa buhay. Ang governance approach po ng Mandaluyong ay nakatuon sa advocacy na may puso at datos. Sa tulong ng The Challenge Initiative platform na isinabuhay natin sa pamamagitan ng participatory planning, capacity building, at adaptive implementation, na itaas natin ang antas ng serbisyo at kaalaman sa reproductive health. Ang TCI process ay naging daan upang ma-scale up ang mga best practices mula sa peer education, youth-friendly clinics, hanggang sa digital engagement ng kabataan. Ito ay hindi natin magagawa mag-isa. Kaya't buong puso naming pinasasalamatan ang Zwillig Family Foundation sa pamunguna ng kanilang President at Executive Director Ginoong Austir Panadero sa walang sawa pong suporta, mentorship at partnership. Ang kanilang malasakit ay naging ilaw sa ating landas tungo sa mas inklusibo at epektibong serbisyo. Sa Mandaluyong po, naniniwala kami na ang tunay na pamumuno ay hindi lamang nakikita sa mga plano kundi sa mga resulta. At sa tulong ng datos, malasakit at pagkakaisa, patuloy nating isusulong ang isang lungsod kung saang bawat kabataan ay may kakayahang mangarap, magdesisyon at mamuhay ng may dignidad. Isa pong karangalan ang maging kinatawan ng aming butihing Mayor Menchie Abalos. Maraming salamat po at sama-sama po tayo magpatuloy sa pagbibigay ng pag-asa at pagbabago, hindi lamang po sa salita, kundi sa gawa. Magandang hapon po sa inyong lahat.
Thank you, Doc Emily, for contextualizing the challenges faced by our youth in urban spaces. Indeed, this program highlights that the problem of adolescent pregnancy is universal and all-encompassing, so its corresponding solutions require a similar dynamic attitude.
Now, we move to Quezon City, Representing Mayor Joy Belmonte, SQC City Health Officer, Dr. Ramona Asuncion Abarquez. She is a dedicated public servant who rose through the ranks to become City Government Head 3, spearheading public health initiatives, organizational development, and system strengthening. A physician with a Master in Public Health from the University of the Philippines, Manila, she has been recognized for her contributions to reproductive health, cancer advocacy, and collaborative governance. Doc Mona is celebrated for her humility, compassion, and unwavering dedication to public service. The stage is yours, Dr. Ramona Abarquez.
Good afternoon to our fellow champions of health systems reform and adolescent development. It is my distinct honor to speak before you today on behalf of our Quezon City Mayor, Mayor Joy Belmonte. Quezon City stands as a center of the Philippine urban reality, complex, diverse, and bursting with both challenges and opportunities. With a population of over 3.1 or close to 3.2, including approximately 800,000 women of reproductive age, 700,000 households, and hundreds of thousands of adolescents, we serve a constituency that is larger than the several entire provinces. Our jurisdiction spans 142 barangays and 6 legislative districts, covering 171.71 square meters, roughly half of the total land area of Metro Manila. This demographic and geographic magnitude makes us critical player in the national health agenda, but this also means that when we get systems wrong, people suffer in large numbers. Conversely, when we get systems right, we can inspire transformation far beyond our city's borders. And that is precisely why we are here today, to share how Quezon City turned a fragmented service environment into a responsive, adolescent-centered, and institutionally grounded system of care. Before our reforms, we faced a common yet deeply consequential problem: fragmentation. Adolescent health services were available but not necessarily accessible. Departments worked diligently but in silos. A teenager experiencing reproductive health concerns might visit a barangay office, get referred to a health center, but be advised to go to the Social Services Development Department with each handoff, vulnerable to delays, repetition, or complete disengagement. There were no clear mechanisms for case tracking, no shared definitions of urgency or sensitivity, and no integrated platform for cross-departmental support. Each agency held only one piece of the puzzle, and adolescents were left to navigate the disjointed pathways themselves, once while facing stigma, confusion, or fear. This lack of coordination was not merely an operational issue. It was a barrier to equity. Despite our adolescent birth rate remaining within acceptable limits, too many young people were missing timely interventions, especially those from high-risk, marginalized communities. As a local government committed to include governance and public service excellence, we knew we had to respond, not with the band-aid programs, but with structural change. Mayor Joy Belmonte's approach to leadership has been grounded in evidence, equity, and institutional accountability. She understood that if we were to address adolescent health effectively, it could not rely on one department, one project, or one electoral term. In 2021, She championed, enacted Ordinance Number 3128 Series of 2021, a comprehensive law institutionalizing the prevention programs to address adolescent pregnancy in Quezon City. This ordinance did not merely authorize funding, it created the policy and legal architecture for multi-sectoral alignment, allowing the long-term integration and sustainability. Under this ordinance, Quezon City government committed itself to implementing the Information and Service Delivery Network for Adolescent Health and Development, or ISDN for AHD, a model we customized and rebranded as the Quezon City Unified Services and Information Teen Network, or Quasi-Teen. This was more than administrative restructuring. It represented a paradigm shift from isolated service delivery to coordinated, rights-based care, from programmatic solutions to systems transformation. And at the heart of this reform, where the leadership conviction was a leadership conviction, young people must never fall through the cracks of governance. The real work began with a comprehensive mapping exercise across our city's departments. We identified every service that touched adolescent lives, from health consultations and mental health counseling to legal protection, educational support, and economic aid. What we found was both encouraging and alarming. Encouraging because there were many programs available, alarming because they were often disconnected and duplicative. To solve this, we streamlined and clarified each department's role. We created flowcharts, vetted across stakeholders to define who does what, when, and how a case is referred. These weren't hypothetical documents. They became real-time operational tools used daily by frontline staff. In partnership with the Challenge Initiative and the Population Program Supervisors of the Quezon City Health Department, we rolled out a structured training program for ISDN frontliners. These frontliners include health workers, social workers, barangay council members, and guidance counselors, all of whom serve as the first points of contact for adolescents. The training modules were comprehensive. They covered the Adolescent Health Development Program framework, risk screening using the HEAD tool, referral pathways, and protocols across agencies, inclusivity and sensitivity training, including the discussions of SOGI, ESC, mental health, and active listening. And the data privacy, ethical service delivery, and trauma-informed care. Our goal was not only to create a referral network, but to build a community of practice among those who serve adolescents on the ground. Our transformation did not occur in a vacuum. It was enabled by three core drivers. One, political will and executive commitment. Mayor Belmonte did not treat adolescent health as an isolated agenda. She integrated it into the city's strategic plans, gender and development framework, and performance scorecards. Her support ensured cross-sectoral buy-in and sustained momentum. Number two, policy infrastructure. The ordinance and its implementing rules and regulations provided legal clarity and institutional stability. This protected the network from administrative turnover and budget uncertainty. Number three, strategic partnerships. We were not alone. TCI, community-based organizations, and adolescent advocates played key roles in co-developing tools, facilitating capacity building, and providing technical guidance. Through these enablers, What began as a concept evolved into a functioning citywide system that continues to adapt and improve. Today, the results are both quantitative and qualitative. Adolescent birth rates remain within the national targets despite population growth. Modern contraceptive uptake among teens is on the rise, indicating greater access and trust. Departments now collaborate instead of compete, and frontline workers have a clear roadmap for referrals and interventions. Most importantly, adolescents experience the system as unified, not as a maze of disconnected offices. We are also piloting digital referral tracking, enhancing data privacy protocols, and incorporating regular performance reviews and feedback mechanisms into the ISDN operations. This ensures that the system evolves based on actual user experience and frontline realities. This is what it means to shift from transactional to transformational governance. Quezon City's journey shows that the leadership is not just about launching new programs, it is about rebuilding systems from within. When we, as local governments, step up, not just with intent, but with infrastructure, we become proof that adolescent health is not a side issue. It is a governance issue, a human rights issue, and a development issue. As Mayor Joy Belmonte often says, leadership is not about commanding action, it is about creating alignment and sustaining trust, especially among those we sworn to protect. On behalf of Mayor Joy Belmonte and the entire Quezon City government, I thank you for this opportunity to share our story. We stand ready to learn from you and to build stronger systems together for our young people and for the future they deserve. Maraming salamat po at mabuhay tayong lahat.
Thank you, Doc Mona. It is heartening to see that even among our largest and most developed cities, the drive to continuously innovate is there, continuing to improve the lives of our families and our youth.
Our next speaker, still from Metro Manila and representing Pasig Mayor Vico Soto, is their City Health Officer, Dr. Joseph Panaligan. Doc P, as he fondly called, is a physician by training and a public health administrator by specialization. He has been at the helm of the Pasig City Health Department, pushing for reforms towards strengthening and fostering partnerships that expand access to quality services. He aspires to build a resilient, people-centered primary healthcare network for the Pasigueños, upholding dignity, equity, and the trust in community. Let us all welcome Dr. Joseph Panaligan.
Good afternoon po sa ating lahat. It is my honor to represent our handsome Mayor Vico Soto. Apology po sa inyo because he unable to attend to this occasion. So, tagaan na lang po kayo sa akin. Okay, so the Pasig City TCI journey began with amid steady gains in maternal, adolescent, and reproductive health. Barely a year after the pandemic, the city was meeting its key health targets, the antenatal, the postnatal care, to full immunization coverage and contraceptive prevalence. Maternal and under 5 mortality have been declining. This achievement paints a rosy picture of a city truly in the pink of health, with women's health and well-being at the forefront. As one of Mayor Vico Soto's 5 main agenda, our department has received substantial support. From the start, the goal has been clear: achieve universal health care with 100% PhilHealth coverage and fully digitized city health facilities. Through partnership with DCI for IT system, Ateneo de Manila University, and the British government for digital tracking program on non-communicable diseases, we move closer to that vision. Even before UHC required it, we rationalize our human resource to meet WHO standards. Today, every health center has a full complement of professionals, close if not higher than WHO recommended ratio. For 1 physician per 20,000 people, we stand at 1 per 8,500. For nurses, at 1:10,000, we have 1:3,200. For midwives, which is 1:5,000, our is at 1:6,100. We also aim to double the number of our Pasig Health Aides or PHA. This is our city-retained barangay health workers before the end of Mayor Vico Soto's terms in 2028. Even before our partnership with TCI, our efforts of women and adolescents were already in motion. Through the Adolescent Health and Development Program, all 42 health centers were made adolescent-friendly, with personnel trained accordingly. The National Safe Motherhood Program continued to reach mothers through Packet Buntis Congress events with our 2 city-retained hospital. Our surveillance, monitoring, and implementation team traced on facility-based deliveries and capacitated them on the importance of proper facility-based and skilled birth attendance. Our family planning program also strengthened community demand through capacity development, usapan series, and katropa session. Yet, those at the margins will always be the first to show symptoms of inequity. In the case of Pasig, it is adolescent and teenage pregnancy. While fertility rates overall have declined, they remained in the low 20s per 1,000 adolescent birth rates. Those getting pregnant at a younger age, as well as the number of young people diagnosed with HIV/AIDS are increasing. I have been part of this journey for a long time. As a member of the city leadership team from 2013 to 2018 under the city leadership governance programs by the Department of Health, the Development Academy of the Philippines, the Swilig Family Foundations, our focus was addressing high maternal mortality rate. By strengthening our health system through a system-based approach, targeting the 6 building blocks of health, we successfully brought those numbers down. Now, we face with the same problem with different young face still pertaining to maternal health, but something more insidious and generational. That is why our partnership with the Challenge Initiative through the Swilig Family Foundation, the Gates Foundation, came at a opportune time. When then Councilor Cory Raimundo, he is sitting beside there, known for her trademark brilliance as a faculty at the UP Population Institute and public servant at almost a decade, challenged us to rise to the demands of this partnership. Our team answered affirmatively with trepidation. Under her guidance, we anchored our work on 3 principles: right-based approaches, gender sensitivity, and observance of safe space. The 2 years of this project was flurry of activities and personalities. Our small core group of less than 10 people tripled with people from all sectors of Pasig City. Of course, we have youth sectors through the Sangguniang Kabataan and the Youth Development Office, but we also youth partners from the schools and community when we conducted our lectures and community youth surveys on sexuality and behavior. We have been able to engage partners in the health sectors, specialists, private practitioners like the Midwives Association of Pasig, as well as other stakeholders, the DepEd, CSWD, and PMP. When we came up with integrated service delivery network, in series of painstakingly tedious and contentious consultative meetings, which resulted in its adaptation and presentation to barangay officials. Our maternal health programs views teenage and adolescents' pregnancy not as a medical condition, but more a violation of one's human rights, and as such, partnered with the women and child protection programs of both hospital in their case management. Recognizing the adolescent births face higher risk of complications, we established a referral network that considers system capacity and transportation logistic across all hospitals and birthing facilities. No teenage or adolescent mother should end up giving birth in a lying-in facility, or worse, at home, because hospitals are full. Our system now ensures proper referral, conduction, and admission. To prevent repeat pregnancy, the family planning programs has instituted an informed consent-based initiative which reaches out of both teenage and adolescent mother and her parents or guardians regarding the option of initiating family planning methods. We have also utilized our mobile family planning clinics to provide family planning counseling and commodity dispensation in areas with issues regarding geographic access. Also, all health centers have personnel who have undergone competency-based training in family planning. Our partnership with the TCI has been success in many ways. It has changed mindset and transformed the way we work by embedding bridging leadership into our innovation process. Where we once operated in silos, we now practice ownership, co-ownership, and co-creation. This shift has allowed our partners to transcend what is personal into a shared vision, which brought institutional changes geared towards equity. Still, our journey is far from over. Comprehensive sexual education remains to be institutionalized in schools, as well as an ordinance on community-based teen centers. The need to adopt bridging leadership cannot be overemphasized. We are in time when the youth have multiple headwinds coming up against them. With the advent of technology, globalization, everything has just become 1,000 times faster and more complex. It is a challenge that we have to take up upon ourselves. Be one with the young and in coming up with solutions that will strengthen them, help them face the challenge of the times, adolescence and teenage pregnancy, mental health issues, and the growing threat of early onset non-communicable diseases are but some of them. We have to craft policies not just for them, but with them. So, marami pong salamat. Sa Pasig po, umaagos ang pag-asa, sabi ng aming mayor. Thank you po. Magandang hapon po.
Thank you, Dr. P. Para kasama na rin po natin si Mayor Vico, hindi naman nagkakalayo, no? Ayan. Thank you po for the reminder that the heart of all our efforts and sacrifices will always be our youth and their inherent right to enjoy health and freedom to make choices for their future.
Next, we hear from one of our constant champions in TCI. We welcome Honorable Lina O. Montilla, the first female mayor of Tacurong City. A pioneer in local governance, she is admired for her compassion, integrity, and unwavering commitment to transparency and accountability. Under her leadership, Tacurong gained national and international recognition, reflecting her drive for inclusive and people-centered development. Among her strongest advocacies is health and wellness, where she championed multi-sectoral partnerships to ensure lasting progress. Today, we celebrate not only a leader, but a true inspiration, Honorable Lina O. Montilla.
Thank you, Sir Chan. A proud Zwilig Family Foundation Bridging Leader. 2012 po ako with Doc Dory and Doc Joyce, yung aming mentor po. And I'm back for my second term. Good day to everyone. First, let me thank Zwilig Family Foundation and the Challenge Initiative for giving Tacurong City the opportunity to learn, to grow, and to transform. Your partnership has not only guided our city, but has also inspired us to lead with courage, compassion, and purpose. When I first became mayor of Tacurong in 2010, I saw both the promise and the challenges of our city. Tacurong was growing as a commercial hub and also as educational center in our province. Yet, our young people were facing a silent crisis. Teenage pregnancies were rising. Access to accurate information on reproductive health was limited. Families struggled with where to turn for guidance. By the time I finished my first term in 2010. In 2019, I was the first mayor in 2010 to 2019. But I entered Zwilig Family Foundation Bridging Leadership in 2012. And I used it. That's why andito pa rin ako for the second round. Thank you sa tinuro nyo sa akin. Ginamit ko po from the heart yun. Hindi ako nakalimutan ng tao kahit nawala ako 6 years, no? But they feel and they remembered what I did to them when I was the 3-term mayor they have. So, hindi kailangan mag-vote buying. Just do what is right. And I prove it. It's totoo yun. Hindi ako nag-vote buying. We had made some progress, but the issues of adolescent health remained deeply concerning. When I returned as mayor, I realized that the problem was still urgent. But this time, I also saw that we had stronger allies and clearer pathways for change. As a leader, I could not ignore the stories of our young people. I met teenage mothers, some as young as 15, who bravely shared their struggles of raising children while still being children themselves. Families carried heavy emotional and financial burdens. These were not just numbers in a report. They were real lives, real dreams, and real futures at stake. That realization humbled me, and it made me ask, how can we lead differently? How can we protect the potential of every young person in Tacorong? Together with TCI and ZFF, we began to reimagine how Tacorong could respond. We strengthened our Adolescent Sexual and Reproductive Health Committee, giving it a structure, leadership, and a clear mandate. We trained our service provider, health and allied staff, so that they could communicate with young people with empathy and confidence. We certified all health facilities in Tacorong as adolescent-friendly, ensuring that every youth feels welcome, safe, and respected. We involved teachers, guidance counselors, both in public and private schools, barangay health workers, and parents, because the responsibility of protecting our youth is a shared one. We conducted various interventions, identified in our projects, programs, and activities for adolescent sexual reproductive health. We acquired collaterals from various donations during the pandemic, like the weighing scales for children and adults and for infants, distributed to 20 barangays. The results have been encouraging. Tacorong's adolescent birth rate declined from 34 in 2020 to 26 in 2024. Our city allocated local funds to sustain these programs, making sure they continue regardless of external projects. Most importantly, young people now feel that they have trusted adults and safe spaces to turn to. To date, teenage pregnancy remains a challenge. Changing mindsets and social norms will take time. But we now have the foundation to make lasting impact, policies, systems, and partnerships that will endure beyond political cycles. Our vision is clear: a Tacorong where no adolescent is left behind, where every barangay is rich, and where every young person grows up empowered, informed, supported, and well taken care of. As mayor, I commit to sustaining this mission. We will continue to invest in our youth through mindful utilization of our local resources. We will continue to listen to the voices of our young people, and we will use these voices to guide and propel the plans of action of our local governance. Most importantly, we will continue to work hand in hand with the Zwillig Family Foundation and the Johns Hopkins Bloomberg School of Public Health through the Challenge Initiative program led by William H. Gates Senior Institute for Population and Reproductive Health, specifically through their Department of Population, Family, and Reproductive Health. All this we take upon ourselves as all are eager and selfless partners to secure not only the healthier outcomes for today, but especially so that we can also ensure stronger families for tomorrow and the many more years ahead. Every adolescent deserves the knowledge, the services, and the support to make informed choices. This is not just about reducing numbers. It is about restoring dignity, nurturing dreams, and securing futures. This is where my faith has brought me, and this is what I pledge to devote myself to do, to devote my life to do. Be the instrument to the others so that may have a harmonious, well-lived existence. With all my heart, I am forever grateful to the Zwillig Family Foundation, the Challenge Initiative, and all of you here. We move forward with one message: no barangays left behind, no young person left behind. We will journey together side by side, hand in hand. It takes a village to raise a child. Sa bagong Pilipinas, bawat buhay mahalaga. Thank you so much, and may God continue to bless us and guide us all.
Congratulations, Tacloban City and Mayor Lina. Your message highlights how local leadership, even in the face of new responsibilities, can set the direction for long-term systems that truly serve communities.
Capping this leader circle, we go to the home of the champions, General Santos City. Representing Mayor Lorely Geronimo Pacquiao is the Acting City Health Officer of General Santos, Dr. Lalaine Calonzo. Doc Lalaine has been active for 3 decades as a certified family health physician in the public health space, serving at various points as the city's Nutrition Action Officer and as a former director of the General Santos Emergency Hospital and now named Dr. George Royeca City Hospital, before serving as the Assistant City Health Officer. She is a passionate advocate for health equity and systems change. Let us all welcome on stage Doc Lalaine Calonzo.
Magandang Jensen sa inyong lahat. General Santos City, from where famous tagline, Magandang Jensen, was rooted, is a city known across the Philippines as the home of the champions. Indeed, we affirm it once more, right at this very ground, that our city is the origin of people championing a great cause such as family planning. My dear colleagues in the platform, on behalf of our City Mayor, Honorable Lorely Geronimo Pacquiao, I am honored to stand before you to deliver our City Mayor's personal speech. I am Dr. Lalaine M. Calonzo, the Acting City Health Officer of General Santos City. I'm glad to be here today with our partners from the Zwillig Family Foundation and the Challenge Initiative. Sa panahon ng pandemic, ang family planning at reproductive health ay humarap sa maraming challenges. One is the number of women using modern contraceptives went down. When we first encountered the Challenge Initiative in 2020, we learned that not all women of reproductive age have access to basic health services, and family planning in particular. Data shows that our modern contraceptive prevalence rate was only at 31%. It even went down in its lowest number of 20% in 2022. As COVID-19 played a major role. This became a puzzle to me because I thought having health centers would be enough. It was really not. The Zwillig Family Foundation, through the Challenge Initiative Philippines, helped the City of General Santos to conduct deep diving activity, an integral part of the Bridging Leadership Framework that exposes not only the city mayor, but also all stakeholders, which could have given an impact if the pressing concern was rightfully attended. From that activity, the city was able to detect factors that exacerbated the weak service delivery, lack of leadership skill, human resources, and their capacity development, political and financial commitment, to name a few. This struck us in General Santos, and immediately, without any second thought, we crafted an expression of interest in 2021. We checked all areas that could hamper us in making this a reality, but we never wane. As initial steps, giving teeth to our actions with the TCI Philippines is considered a primordial concern. In the course of our 4 years with the platform, initiatives in crafting public policies to strengthen our endeavors to improve and maximize health service delivery were made. They are, number one, we have Executive Order number 33, series of 2022, an act forming the city implementation team on responsible parenthood and reproductive health law. Second, we have the Executive Order number 95-A, series of 2023, the formation of the city itinerant team. That is, through the able leadership of the City Health Office, the City Population Management Office, Dr. George Rieka City Hospital, and all other relating agencies, wherein the provision of health service delivery was made, not only through the words of this speech, but also in numbers that give a vivid picture of General Santos City's active response to the current reality in 2020 and 2021. In particular, I signed the executive orders mentioned because together with me, they are the mapped agencies able to level up family planning services. However, we likewise acknowledge that the LGU alone cannot make it. Thus, we also partnered with private sectors, such as the United Private Midwives of General Santos City and the Family Planning Organization of the Philippines, SOC Sargent Chapter. Together with the TCI, we all made it to make what is seemed to be an impossible at first. We concentrated on our local health systems, that to be able to bring the best to our clientele. We had to capacitate our health service providers, from doctors, nurses, midwives, up to our own barangay health workers. Likewise, we further strengthen our public-private partnerships to intensify achieving our goals of this area of public health. We also have ensured logistics to avoid stock out of commodities as it will be in place, reaching each rural health unit always on time. Data we gathered from our meetings and field assessments were used to come with a good decision-making as well. Today, after 4 years of painstaking endeavors with our 2 city technical leads assigned, previously we have Julianne Liavore, and presently we have Sir Troy Vincent Bautista. Nasaan si Sir Troy? Sir Troy, your presence malaking tulong sa amin sa General Santos City, and I will ask everybody to give him a round of applause. I am proud to present to you today the fruits of our non-stop work. Out of the 675 barangay health workers, 100% oriented on basic family planning. There are 14 rural health units, health facilities, 100% able to provide family planning services, as well as the Dr. George P. Royeca City Hospital. 15 new healthcare workers trained on the Level 1 and Level 2 family planning community-based training. 24 healthcare providers trained on adolescent skills enhancement training 2.0. We have strengthened our public-private partnership to meet sustainable actions in addressing health inequities. Our modern CPR increased consistently since 2022. In 2022, we have 29%, 2023, 31%, and in 2024, we got 34%. These are simple but meaningful steps. Proof that we work together, we can make real progress. What are the lessons learned from here? First, as the local chief executive, I need to have a serious consideration on the problem until I am able to recognize its existence and own the same. There will be no movement to happen unless I take it personally to myself to recognize that such is here and around. That's ownership. But taking cognizance of any problem and owning does not suffice. Bringing the other stakeholders and agencies to recognize the same is another story to tell. Of course, one must acknowledge that a complex problem cannot be easily resolved, and the help of different individuals around you would make it easy to find best ways to address it. We did it in our city. Yes. While others may be of different views on family planning issues, we nevertheless hurdle the issues every step of the way, enabling everyone to co-own as well as the complex problem. Finally, we must be all together in meeting the ends. As said, we are of different views in treating issues in family planning. Being open to accepting and co-creating ideas, no matter how friendly or contrary they may be, help us to put together these views to form a reservoir of contributions used to address the pressing issues. We did what seemed is impossible, but with our conviction to maintain the course, to enable service delivery to all the women of reproductive age, General Santos was able to finally realize its one united goal of having a very good family planning services across our 26 barangays. That is why I would like to take this opportunity to thank the Zwilig Family Foundation, the Challenge Initiative, and all our partners for walking this journey with us. We are more inspired in creating a stronger and healthier General Santos City. Magpapatuloy po ang mga hakbang upang matiyak na magagawa namin ito para mapahusay pa ang family planning services sa General Santos City. Maraming salamat po, mabuhay tayong lahat, and God bless everyone.
Thank you, Doc Lalaine. That was a heartfelt message from Mayor Lori Lee. Her pledge to devote her life as an instrument for others is deeply inspiring. Thank you for all our leaders in showing us that governance, when rooted in care for people, can truly transform lives and communities. As we move forward, may we carry the same spirit of unity and shared responsibility that you demonstrate so powerfully. Maraming salamat po for our champions, for inspiring us to continue this journey together. Palakpakan po ulit natin silang lahat.
At this juncture of the program, I'm sure everyone has learned or heard something new or interesting. Perhaps a new approach or a new way to framing our solutions that can help our own cities. To help us understand how these local successes align with national health priorities and population development strategies, we are joined by distinguished representatives from our partner agencies to share their insights.
It is a distinct honor to introduce Sir Kevin De Vera, Director for Programs and Advocacy of the Forum for Family Planning and Development. Kevin is a professional teacher and a registered nurse who has been in development work for over a decade, managing development projects on sexual health and reproductive rights, HIV/AIDS prevention education, population health and development. Again, let us all welcome Sir Kevin De Vera.
Hello, good afternoon. I will not take so much of my time. I only have 3 quick realizations, take-home learning from the entire day's meeting and conversations. So first off, I'd like to extend my appreciation to ZFF and the TCI team, and of course to all the leaders coming from different parts of the country. So the 3 points I'd like to raise, first one, common experience sa marami ang institutional and social integration for inclusive health access. Institutional integration wherein we are able to recognize the fact that most of the time, we are doing our programs in silos, and integrating it can actually serve our constituency better, especially along the lines of sexual and reproductive health na for the longest time seem to be neglected in many parts of the country. At the same time, social integration as a process ng pagpapaunlad or development wherein we are able to recognize the importance of including young women, indigenous people, and other marginalized group in the conversations. Not just in the conversations, but also reinforcing the existing inequalities. So itong mga population groups na ito, oftentimes, they are faced with layered barriers. Sa ibang lugar, pwedeng cultural, sa karanasan ng ibang LGU, linguistic, sa marami economic, at common sa atin lahat, systemic. Kung halimbawa, yung ating mga programa mismo at mga policies ang nagfi-fail. So I think, to keep them from experiencing inequalities, we should always consider yung dalawang yun based sa karanasan ng marami sa atin ngayon. Pangalawang pulot ko po is that community-initiated demand generation, I think, is one way of really sustaining small steps, baby steps, especially to consider that hindi naman mahaba yung journey with TCI, but then again, ang daming effort. At nakita natin, based sa mga discussions kanina, that the demand services must not be manufactured solely through top-down campaigns. In fact, there were a lot of sharings na ang ganda ng lesson if this emerges organically from the communities. Ito yung mga community of people na informed, empowered, and of course, equipped with tools so that they themselves can take ownership of the reproductive health and the reproductive health of their neighbors. So nakakatuwa yung mga ganong klaseng discussions. I think maganda ang mga lessons ng karanasan ng mga LGUs, and we need to shift from being mere service providers, program planners. In fact, ang ganda ng shift kapag tayo ay mas nagiging capacity builders. Wherein, we train local champions, doon mismo sa community, more peer educators, youth leaders, yung mga schools na ini-involve natin, barangay health workers and other community volunteers, at mga kalalakihan sa practice or experience ng ibang mga kasama nating LGUs. So technically, yung community initiated through capacity building, it creates a sustainable force for advocacy and service utilization. So napakamagandang pulot po yun. Lastly, my point number 3 is we need to keep on enabling a supportive and friendly political environment. Honestly, nakaka-inspire at nakakatuwa na nakikita na natin ang ating mga local legislators, ang ating mga mayor, that they themselves have this pronouncement na kailangan natin suportahan. Dapat meron tayong adolescent-friendly, na dapat livable, safe ang mga spaces para sa mga kabataan, lalo na patungkol sa usapin ng sexual and reproductive health. Sa maraming parte sa Pilipinas, sa ibang LGUs, hindi pa ganun. Actually, malayo pa sila. Pero tayo dito sa hall na to, medyo naumpisahan na natin. I think I'd like to close my reaction for everyone here, to our leaders, our champions, planners, and implementers. I believe yung journey with TCI, based on the sharing, you were able to influence and you were able to reach. And you have the power to shape the system that are inclusive, community-led, and politically supported. So please, 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 let's continue this transformational impact where every young person, every woman, and every indigenous community member can access reproductive health services. Mabuhay po at maraming salamat.
Thank you very much, Sir Kevin.
Our second reactor is no stranger to TCI graduations. In fact, she has been with us in all 3. Talk about support and dedication. Representing the Commission on Population and Development is Ms. Jacqueline Robel, Regional Director of CPD National Capital Region. With over 20 years of experience in population and development, Ma'am Jackie has honed her expertise in policy planning and program evaluation. A proud UP alumna, she holds a master's degree in population studies and a bachelor's in communication research, both from the University of the Philippines, Diliman. Through her leadership, Ma'am Jackie continues to strengthen evidence-based population and development programs in her region. Let us give a warm welcome to Director Jacqueline Robel.
Magandang hapon po sa lahat at masayang pamilya. Listening to the inspiring discussions across these 2 panels, one cannot help but feel proud and hopeful. What we have witnessed today is not just a sharing of programs, but a tapestry of innovation, compassion, and leadership woven together by local champions. Each city's journey, whether in family planning or adolescent health, reminds us that when local governments lead with empathy and evidence, transformation truly happens. From panel 1, we saw how cities like Tagum, General Santos, Isabela, Iriga, Lapu-Lapu redefined what family planning means for their communities. They faced pandemic disruptions, cultural resistance, and service delivery gaps, but through partnership, leadership, and persistence, they built systems that endure. In Tagum City, the story of Usapang Youth and Mr. God Pegad showed how the youth and men can become champions of responsible parenthood. This shift from family planning as a woman's concern to a shared family responsibility is a lesson in social transformation. This invites us to continually integrate gender and youth empowerment into our demand generation and IEC strategies. General Santos City demonstrated the importance of a local leadership and institutional backing through its Executive Order 95-A, establishing a City FP itinerant team that ensures service continuity, data accuracy, and coordination across agencies. This shows that sustainability begins with policy direction. Meanwhile, Isabela City and Iriga City offered powerful examples of culturally sensitive governance. In Isabela, the integration of Ulama Council and IP leaders in reproductive health conversations shows deep respect for faith and tradition, an approach that fosters trust rather than tension. In Iriga, the inclusion of tribal leaders and the empowerment of indigenous barangay health workers illustrated how cultural humility builds bridges to equity. And in Lapu-Lapu City, we saw how investing in barangay health workers through training, motivation, and inclusion creates a strong community network that sustains both demand and service delivery. In panel 2, we saw Mandaluyong City reframed adolescent pregnancy not as a moral failure, but as a public health concern. Their Healthy Young Ones series and Adolescent Congress are clear models of how young people can be reached with dignity and confidence. From Pasig City, we learned about breaking silos and building an information and service delivery network that allows adolescents access coordinated, rights-based care. Their application of bridging leadership, where agencies co-own the problem and co-create solutions, reminds us that governance is most effective when it is shared. Quezon City, on the other hand, demonstrated how programs can be secured through policy. Their Adolescent Pregnancy Prevention Ordinance, SP-3128, series of 2021, institutionalizes services, establishes the Adolescent Pregnancy Prevention Council, and strengthens the ISDN. This is the kind of long-term policy architecture that CPD seeks to support among our partner LGUs. Finally, Tacurong City's rapid certification of 24 adolescent-friendly health facilities showed how systems can scale without sacrificing quality. We see rich opportunities for cross-learning. These innovations remind us to strengthen local population and health councils as governance hubs, support LGUs in establishing or enhancing their ISDNs, institutionalize adolescent and family planning programs through ordinances and executive orders, and ensure culturally sensitive, inclusive, and data-driven interventions. To all our city partners, our heartfelt congratulations. Your commitment shows that while challenges may differ from the coastal barangays of Lapu-Lapu to the bustling districts of Quezon City, our goal remains the same: to empower Filipino families and adolescents to make informed, responsible, and hopeful choices. Let us continue this momentum. Let us continue linking family planning and adolescent health as one integrated mission. For when we invest in young people and families today, we are building the very foundation of a resilient and prosperous nation. Maraming salamat po. Congratulations po dun sa siyam na LGUs na nag-graduate today. And congratulations to all our champions of innovation and compassion. Masaya ang pamilya po sa lahat. Thank you very much.
Thank you so much, RD Jackie.
For the last reactor, we are joined by a representative from the Department of Health, Disease Prevention and Control Bureau and Family Planning Program Coordinator, Dr. Marie Jasca Nicolas. Doc Marie Jasca is a product of University of the Philippines, College of Public Health, and College of Medicine. A physician with a passion for serving the people, she served as a doctor to the barrio before taking her passions to the Department of Health, where she currently provides technical guidance and strategic steering over the country's family planning program. Let us all hear from Dr. Marie Jasca Nicolas.
Good afternoon, everyone. So, of course, congratulations to our LGUs and also to TSI for this event, and also for all the appreciation po natin sa inyong mga accomplishments. So maraming salamat nga po no, sa ating mga LGUs and of course sa The Challenge Initiative para po sa inyo pong mga contributions in line with family planning and reproductive health. So gamit po ang inyong mga efforts po, no, nakikita namin at the national level kung paano po nagiging policy, ang policies ay nagiging into practice. So yun po yung isa naming very na-appreciate po dito sa ating presentation. And then the two key points that talagang tumatak sa akin for this event is that seeing family planning and reproductive health not just numbers, but a right. So, paulit-ulit din po yun, no? Na minsan po, no, na dadala po tayo ng mga sa numero. So, katulad po ngayon, ang Pilipinas ay nasa below replacement rate in terms of fertility rate. Sa atin naman pong demand satisfied by modern family planning methods, na-reach na po natin yung ating target for 2024 and 2025. So, hindi po dahil lang po doon no, na dapat po tayong huminto sa ating mga efforts. Ang dapat po natin mabigay at ma-ensure po sa ating mga kababayan ay ang makuha po nila ang right po nila sa kanilang reproductive health. Na may choice po sila kung kailan po sila magkakaanak at may choice din po sila sa magiging direksyon po nila sa kanilang future. Another key takeaway ko po sa event po na ito ay ang pagkita po nga sa reproductive health bilang hindi lang health concern. So maraming salamat po, lalo na po sa ating mga leaders no, na hindi man nasa linya ng health pero nakikita po ang halaga nito. So kahit po no, sa amin sa national level, we recognize that DOH cannot do it alone at kailangan po natin ang suporta ng iba't ibang hanay ng gobyerno. So papasalamat nga po ako no, sa CPD, sila po ang madalas nating kapartner. And of course, the youth involvement. And ngayon po, no, mas tumataas na rin nga po ang ating male involvement. So ang akin pong hamon, no, mahirap po kasi sa term po natin ngayon, graduation or pagtatapos. Pero syempre po, hindi po dapat dito matapos ang ating mga binibigay para sa ating serbisyo ng reproductive health. So ang hamon ko po sa inyo ay ang patuloy nga po na leadership and accountability for the family planning programs and ownership po ng ating mga activities. So like I said po, no, hindi po ito kaya ng DOH lang. So kailangan po namin talaga ang every sector para matulungan po kami sa pag-forward ng reproductive health. And another po na ating call to action is to always participate in this kind of activity po na feedback po sa amin ito at the national level so that we can also know kung ano po yung mga further pa po nating magagawa at ano po ang mga needs po sa ating mga communities. So yun lang po, maraming salamat po and again, congratulations.